Herpes simplex virus, HSV, is one of the most common viral infections worldwide, affecting millions of people regardless of age, gender, or background. Despite its prevalence, HSV remains a subject surrounded by stigma, misinformation, and confusion. Many individuals living with the virus feel isolated due to the misunderstandings surrounding it, while others may struggle to manage the physical, emotional, and psychological effects of the infection. This book aims to address these challenges by providing clear, accurate, and practical information about HSV, empowering readers to understand, prevent, and manage the condition. The goal of this book is not only to inform, but also to foster a compassionate, stigma-free approach to living with herpes. We will explore the different types of herpes simplex viruses, HSV1 and HSV2, and how they impact the body. By understanding the biology of HSV and the various transmission methods, readers will be better equipped to make informed decisions about their health and relationships. Prevention is key to managing herpes, and we will cover essential strategies for reducing the risk of transmission, including safe practices, medication, and lifestyle adjustments. Whether you're newly diagnosed or have been living with the virus for years, the information provided here will offer practical tools for reducing the frequency and severity of outbreaks, as well as improving quality of life. Managing herpes goes beyond simply controlling symptoms. In this book, we delve into the emotional and psychological aspects of the virus, addressing common concerns such as dealing with guilt, shame, and the impact on relationships. By providing resources and strategies for coping, we aim to support readers in navigating the personal and social challenges associated with living with HSV. As research in the field of herpes continues to evolve, we will also explore the latest advances in treatments, potential vaccines, and what the future holds for those affected by the virus. This book is a reflection of both the current understanding of herpes and the hope for continued progress in managing and eventually eradicating this condition. Whether you are seeking answers, support, or a deeper understanding of HSV, this book is designed to be a comprehensive guide. It offers not only medical insights, but also emotional and practical advice, all rooted in the belief that knowledge, compassion, and awareness can make a profound difference in the lives of those living with herpes. Introduction to herpes simplex virus, HSV. Herpes simplex virus, HSV, is a highly contagious viral infection that affects millions of people worldwide. The virus is classified into two types, HSV1 and HSV2, each of which can cause different manifestations of the infection. HSV1 primarily causes oral herpes, which manifests as cold sores or blisters around the mouth and face. However, it can also lead to genital herpes through oral genital contact. HSV2, on the other hand, is the most common cause of genital herpes, but can also affect other parts of the body through direct contact with infected areas. The transmission of HSV occurs through direct skin-to-skin contact with an infected person, usually during an active outbreak, though it can also occur when no visible symptoms are present. This ability to transmit the virus even in the absence of symptoms makes HSV particularly difficult to control and adds to the complexity of its management. The virus can be spread through kissing, sexual intercourse, and even touching contaminated surfaces, such as towels or razors, although this is less common. Once a person is infected with HSV, the virus remains in the body for life, residing in the nerve cells. After the initial infection, the virus can become dormant, only to reactivate later, often triggered by factors such as stress, illness, a weakened immune system, or hormonal changes. These reactivations can result in outbreaks that vary in frequency and severity. While some people may experience only occasional outbreaks, others may face recurrent episodes. Although HSV infections are generally not life-threatening, they can cause significant discomfort and emotional distress. Symptoms include itching, pain, and the appearance of blisters, which can lead to a range of challenges. both physical and psychological. The stigma surrounding the virus, especially genital herpes, further complicates these challenges, as individuals with HSV often face feelings of shame, isolation, and anxiety about disclosing their status to potential partners or loved ones. Despite these challenges, HSV is a manageable condition. With proper treatment, lifestyle adjustments, and a supportive approach, individuals with HSV can lead healthy, fulfilling lives. Understanding the virus, its transmission, and available treatments is essential in reducing its impact on one's health and well-being. This book aims to provide a comprehensive guide to living with HSV, offering practical advice for preventing and managing outbreaks, as well as addressing the emotional and social aspects of the condition. Importance of prevention and management. Preventing and managing herpes simplex virus, HSV, is essential not only to reduce the frequency and severity of outbreaks, but also to minimize the risk of transmission to others. Given that HSV is a lifelong infection, the focus on prevention and management becomes key to maintaining a good quality of life for individuals affected by the virus. While there is no cure for HSV, understanding and implementing effective prevention strategies, along with proactive management techniques, can significantly alleviate both physical symptoms and emotional distress. Prevention plays a critical role in controlling the spread of the virus. Since HSV can be transmitted even in the absence of visible symptoms, taking precautions is vital to protect sexual partners and others who may come into contact with the virus. Regular use of barrier methods, such as condoms, during sexual activity is one of the most effective preventive strategies, though it cannot guarantee complete protection due to the possibility of exposure to infected skin or mucous membranes not covered by the condom. Additionally, open and honest communication with sexual partners about HV status can help to reduce anxiety and prevent unintentional transmission. For those already living with HSV, effective management is essential for minimizing the frequency and severity of outbreaks. Antiviral medications, such as acyclovir, valacyclovir, and famciclovir, can help to suppress the virus and reduce the duration of outbreaks. These medications are particularly effective when taken at the first sign of symptoms or as suppressive therapy for individuals who experience frequent outbreaks. Beyond medications, lifestyle factors also play a significant role in managing HSV. Stress, illness, fatigue, and immune system suppression are common triggers for outbreaks. Thus, adopting strategies to manage stress, maintain overall health, and avoid known triggers can help individuals living with HSV to experience fewer outbreaks and improve their quality of life. Additionally, emotional and psychological management is a critical aspect of living with HSV. Many people with the virus struggle with feelings of shame, guilt, or anxiety due to the stigma associated with herpes. These emotional challenges can affect relationships and mental health, further complicating the management of the condition. Education, support groups, and counseling can be invaluable resources for individuals navigating the emotional aspects of living with HSV, providing reassurance, understanding, and strategies for coping. Ultimately, prevention and management of HSV go hand in hand. By adopting a comprehensive approach that includes medical treatment, lifestyle adjustments, and emotional support, individuals can significantly reduce the impact of the virus on their lives while also minimizing the risk of transmitting it to others. Chapter 1: Understanding Herpes Simplex Virus. Herpes simplex virus, HSV, is a common viral infection that affects millions of people worldwide. It belongs to the herpes virus family, which also includes other viruses such as chickenpox, mononucleosis, and cytomegalovirus. HSV primarily manifests in two forms, HSV1 and HSV2, each of which causes different types of infections, although they can overlap in their effects. HSV1 is most commonly associated with oral herpes, which causes cold sores or blisters around the mouth, lips, and face. This form of the virus is typically contracted during childhood through non-sexual contact. such as kissing or sharing utensils. However, HSV1 can also lead to genital herpes through oral genital contact. In recent years, there has been an increase in HSV1 cases causing genital herpes, especially among younger populations. HSV2, on the other hand, is primarily responsible for genital herpes. It is most often transmitted through sexual contact, either during an active outbreak or when no symptoms are present. While HSV2 is the most common cause of genital herpes, it is important to note that both HSV1 and HSV2 can cause infections in the genital area, though the symptoms and frequency of outbreaks may differ. Once a person contracts HSV, the virus remains in the body for life. It enters the body through mucous membranes or broken skin and travels along the nerves to the spinal cord, where it can become dormant. In this dormant state, the virus does not cause any symptoms and remains inactive for an unpredictable period. However, certain triggers, such as stress, illness, hormonal changes, or a weakened immune system, can reactivate the virus, leading to outbreaks. These outbreaks typically involve the appearance of blisters or sores in the area of infection, which can be painful and uncomfortable. While the symptoms of HSV can vary, some individuals experience only mild or even no symptoms at all, making it possible to have the virus without realizing it. In fact, many people with HSV are unaware of their infection, and it is only through testing or the occurrence of an outbreak that they discover they are carriers of the virus. Understanding HSV is essential to managing and preventing its spread. In the following chapters, we will explore how the virus is transmitted, the various ways it can be diagnosed, and the methods available for preventing and managing outbreaks. By gaining a deeper understanding of HSV, individuals can make informed decisions about their health and take proactive steps to reduce the impact of the virus on their lives. What is HSV? Herpes simplex virus HSV is a viral infection caused by two types of the herpes virus family, HSV1 and HSV2. Both types of HSV can lead to lifelong infections in humans, with the virus remaining dormant in the body and reactivating at various times, often triggered by stress, illness, or other factors. HSV primarily affects the skin and mucous membranes, causing outbreaks of sores or blisters. These outbreaks can occur in different areas of the body depending on the type of HSV involved. HSV1 is most commonly associated with oral herpes, which leads to cold sores or blisters around the mouth, lips, and face. This form of the virus is primarily transmitted through non-sexual contact, such as kissing or sharing utensils, and is often contracted during childhood. However, HSV1 can also be transmitted to the genital area through oral genital contact, resulting in genital herpes. In fact, HSV1 has become an increasingly common cause of genital herpes in recent years, especially in younger people. HSV2 is mainly associated with genital herpes, which is transmitted through sexual contact. It is most commonly spread during an active outbreak, but the virus can also be passed on when no visible symptoms are present. HSV2 infections can cause painful sores and blisters in the genital and anal areas, though outbreaks may also occur in other parts of the body, including the thighs and buttocks. Both HSV1 and HSV2 infections are highly contagious. The virus can be transmitted through direct contact with an infected person's skin or mucous membranes, such as during kissing, oral sex, vaginal sex, or anal sex. Even if no symptoms are visible, an infected person can still transmit the virus, often referred to as asymptomatic shedding. This means that a person may unknowingly spread HSV to others without experiencing any obvious outbreaks. Once a person is infected with HSV, the virus enters the body and travels along the nerves, where it can remain dormant for long periods of time. During this dormant phase, the virus causes no symptoms, but certain triggers, such as stress, fatigue, illness, or hormonal changes, can reactivate the virus and lead to another outbreak. While there is no cure for HSV, the infection can be managed with antiviral medications, which help to reduce the frequency and severity of outbreaks, as well as the risk of transmission to others. Understanding HSV is crucial to minimizing its impact on health and relationships, as well as reducing the stigma associated with the infection. Types of herpes simplex virus, HSV1 and HSV2. Herpes simplex virus, HSV, is categorized into two primary types, HSV1 and HSV2, each of which is responsible for different manifestations of the infection. While both types are caused by the same family of viruses, they differ in the areas they most commonly affect, their transmission methods, and their tendency to cause recurrent outbreaks. Despite these differences, both HSV1 and HSV2 are lifelong infections, and individuals who are infected with either type carry the virus for life. HSV1 is most commonly associated with oral herpes, which causes cold sores or blisters around the mouth, lips, and face. This form of the virus is typically contracted in childhood through non-sexual contact, such as kissing or sharing utensils, although it can be spread at any age. HSV1 can also cause genital herpes, particularly when oral genital contact occurs. In recent years, an increasing number of genital herpes cases are being attributed to HSV1, especially in younger populations, making it important to consider both types when discussing herpes infections. While HSV1 outbreaks tend to occur less frequently in the genital area, they can still be painful and require management. HSV2, on the other hand, is the more common cause of genital herpes, typically transmitted through sexual contact. It is most often spread during an active outbreak, but like HSV1, it can also be passed on when no symptoms are present through asymptomatic shedding. This type of herpes causes painful sores and blisters in the genital, anal, and sometimes other areas of the body. While HSV2 is predominantly sexually transmitted, it can also be transmitted from a mother to her baby during childbirth, which is a serious concern if the mother has an active outbreak during delivery. Although HSV1 and HSV2 are distinct in their typical sites of infection, both types of the virus have the ability to remain dormant in the body after the initial infection. Once inside the body, the virus travels along the nerves to the spinal cord, where it can lie inactive for extended periods. Various triggers, such as stress, illness, or a weakened immune system, can reactivate the virus, leading to new outbreaks. Despite the differences between HSV1 and HSV2, both types can cause similar symptoms, including itching, pain, and the appearance of blisters. Effective treatment options, including antiviral medications, can help manage outbreaks, reduce the risk of transmission, and improve the quality of life for those living with the virus. How HSV is transmitted. Herpes simplex virus, HSV, is highly contagious and is primarily transmitted through direct contact with an infected person's skin or mucous membranes. Transmission can occur even when an individual is not showing visible symptoms, making it possible for the virus to spread unknowingly. The two main routes of transmission are through oral and sexual contact, with HSV1 and HSV2 having distinct patterns of spread. HSV1, which typically causes oral herpes, is most commonly transmitted through non-sexual contact. It is easily spread through kissing, sharing personal items such as towels or eating utensils, or engaging in activities where saliva is exchanged. This is why cold sores, often the result of HSV1 infection, are so common in children. In recent years, however, HSV1 has also become a significant cause of genital herpes, transmitted via oral genital contact. When someone with oral herpes performs oral sex on another person, the virus can be transferred to the genital area, leading to genital herpes symptoms. HSV2 is primarily transmitted through sexual contact, including vaginal, anal, and oral sex. The virus is most contagious during an active outbreak when sores or blisters are visible, but it can also be spread when there are no visible symptoms through a process known as asymptomatic shedding. This means that an infected person can transmit the virus to others even when they are not experiencing an outbreak or have no noticeable symptoms. Asymptomatic shedding occurs when the virus is released from the skin or mucous membranes without causing any outward signs, making it particularly challenging to prevent transmission. In addition to sexual and oral contact, HSV can also be transmitted through close skin-to-skin contact, such as touching an infected area and then touching another person's skin or mucous membranes. This type of transmission is less common but still possible, particularly if the virus is present in an active or latent state on the skin. Another important route of transmission is from mother to child during childbirth. If a woman has an active HSV2 outbreak at the time of delivery, the virus can be passed to the baby, potentially leading to neonatal herpes, a rare but serious condition that can cause severe health complications. Preventing HSV transmission involves consistent use of barrier methods, such as condoms during sexual activity, open communication with partners about HSV status, and avoiding contact with active sores. Even when no symptoms are present, precautions such as antiviral medications can significantly reduce the risk of transmitting the virus to others. Symptoms and stages of HSV infection. The symptoms and stages of herpes simplex virus HSV infection can vary widely from person to person. Some individuals may experience only mild symptoms or none at all, while others may suffer from frequent outbreaks. Understanding the typical progression of HSV infection can help individuals identify and manage the condition more effectively. After initial exposure to HSV, the infection usually progresses through several stages. The first stage is known as the primary infection, which occurs shortly after the virus enters the body. During this stage, an individual may experience flu-like symptoms such as fever, swollen lymph nodes, and fatigue, in addition to the characteristic appearance of sores or blisters in the infected area. The primary outbreak is often the most severe, with a greater number of lesions and more discomfort. It typically lasts anywhere from 7 to 14 days. And although the symptoms may be intense, they generally improve with antiviral treatment. The primary infection is also the stage when the virus is most contagious, as active sores are present and the risk of transmission is high. Once the primary infection resolves, the virus travels along the nerves to the spinal cord, where it enters a dormant phase. During this latency period, the virus is inactive and does not cause any symptoms. However, HSV remains in the body for life, and reactivation can occur at any time. The reactivation is triggered by various factors, such as stress, illness, a weakened immune system, or hormonal changes. When the virus reactivates, it travels back along the nerve pathways to the skin or mucous membranes, leading to the recurrence of symptoms. Recurrent outbreaks tend to be less severe than the initial infection and are often characterized by fewer lesions that heal more quickly. The symptoms may include itching, tingling, or a burning sensation before the appearance of sores or blisters. These prodromal symptoms signal that an outbreak is imminent and can help individuals take precautions to prevent transmission. While recurrent outbreaks are generally shorter and less painful, they can still cause discomfort and emotional distress, particularly when they occur in visible areas like the face or genital region. The frequency of outbreaks varies from person to person. Some individuals may experience occasional flare-ups, while others may have frequent recurrences. Factors such as immune system health, stress levels, and lifestyle choices can influence the frequency and severity of outbreaks. With appropriate treatment, including antiviral medications, the frequency and severity of outbreaks can often be reduced, helping individuals with HSV manage the condition and reduce its impact on their lives. Chapter 2: Diagnosis and Testing for Herpes. Accurate diagnosis and testing are crucial for managing herpes simplex virus HSV infections. Since the symptoms of HSV can vary widely and often resemble those of other skin conditions or infections, it is important to confirm the presence of the virus through appropriate medical tests. Diagnosing HSV helps individuals understand their condition, make informed decisions about their health, and take steps to prevent transmission to others. The first step in diagnosing HSV typically involves a physical examination by a healthcare provider. If a person has visible sores or blisters, the provider can often make a preliminary diagnosis based on the appearance and location of the lesions. The sores caused by HSV tend to have a characteristic look: small, fluid-filled blisters that rupture and form painful ulcers or crusts. However, since not all individuals with HSV experience visible outbreaks, or their outbreaks may be mild, a more thorough diagnostic approach may be necessary. One of the most reliable methods for diagnosing HSV is a laboratory test that involves taking a sample from the lesion. This can be done through a swab of the fluid from an open sore or blister during an active outbreak. The sample is then analyzed in a laboratory to identify the presence of HSV DNA or the virus itself. This type of test, known as a viral culture or PCR, polymerase chain reaction test, is highly accurate during an active outbreak when the virus is abundant in the lesion fluid. A positive result confirms that the individual is infected with HSV. In some cases, a blood test may be used to diagnose HSV, especially if a person has no visible sores or if they are seeking confirmation of a past infection. A blood test detects antibodies produced by the immune system in response to the virus. There are two types of antibodies that the test may look for: IgM, which appears soon after infection, and IgG, which develops later and indicates a past infection. Blood tests can differentiate between HSV1 and HSV2, helping to determine the type of infection. While blood tests are useful for identifying whether someone has been exposed to the virus, they may not be able to detect a current outbreak if no visible lesions are present. Additionally, false positives or false negatives can sometimes occur, particularly in people who have never experienced an outbreak or have very low levels of the virus in their blood. For individuals who are unsure of their HSV status or experience frequent outbreaks, consulting a healthcare provider for appropriate testing is essential. An accurate diagnosis not only confirms the presence of the virus, but also allows individuals to explore treatment options, learn about prevention strategies, and reduce the risk of transmitting the virus to others. Identifying herpes symptoms. Recognizing the symptoms of herpes simplex virus, HSV, is essential for early diagnosis and effective management of the infection. While some individuals with HSV may not experience any noticeable symptoms, others may experience frequent outbreaks with clear physical signs. Understanding the symptoms of both initial and recurrent herpes outbreaks helps individuals seek medical attention promptly, reduce the risk of transmission, and manage the condition more effectively. The symptoms of HSV infections vary depending on the type of the virus, HSV1 or HSV2, and the location of the outbreak. The initial infection, known as the primary outbreak, is often the most severe and can present with a range of flu-like symptoms in addition to the characteristic sores or blisters. These symptoms may include fever, swollen lymph nodes, headache, muscle aches, and a general feeling of illness. The appearance of painful, fluid-filled blisters in the affected area is the hallmark sign of HSV infection. These blisters typically break open, forming painful ulcers that eventually crust over and heal. The sores can appear on the mouth, lips, or genital area, depending on the type of HSV involved. In some cases, the sores may be accompanied by itching, burning, or a tingling sensation. After the primary outbreak, the virus enters a dormant phase, remaining in the body without causing symptoms. However, HSV can reactivate at any time, leading to recurrent outbreaks. Recurrent outbreaks are typically less severe than the initial infection and may involve fewer sores or blisters. Some individuals experience prodromal symptoms, which are early warning signs that an outbreak is imminent. These symptoms can include itching, tingling, or a burning sensation in the affected area, even before the blisters appear. Recognizing these prodromal symptoms can help individuals take precautions to prevent transmission to others and start antiviral treatment early, potentially reducing the severity and duration of the outbreak. The location of the sores can vary depending on the type of HSV infection. HSV1 typically causes oral herpes, with sores appearing on the lips, mouth, or face. It can also cause genital herpes, especially through oral genital contact. HSV2 most often causes genital herpes, with sores appearing in the genital, anal, or perineal areas. In some cases, HSV can cause sores in other areas of the body, such as the eyes or fingers, though these occurrences are less common. Identifying herpes symptoms is crucial for individuals living with the virus, as it enables them to manage their condition effectively, reduce the risk of transmitting the virus, and seek appropriate medical care when necessary. Understanding the signs of an outbreak also empowers individuals to take proactive steps in managing their health and preventing complications. Diagnostic methods. Accurately diagnosing herpes simplex virus, HSV, is essential for effective treatment and management of the infection. There are several diagnostic methods available, each suited to different circumstances. The appropriate method depends on whether an individual is experiencing active symptoms, the type of infection, and the healthcare provider's recommendations. Early and accurate diagnosis can help individuals take the necessary steps to manage outbreaks, reduce transmission risks, and improve overall health outcomes. The most common and reliable diagnostic method during an active outbreak is a viral culture or polymerase chain reaction (PCR) test. A healthcare provider typically collects a sample from the fluid of an open sore or blister. This sample is then sent to a laboratory where it is tested for the presence of HSV DNA. PCR testing is particularly sensitive and can detect even small amounts of the virus. It is often the gold standard for diagnosing active herpes infections, providing a clear indication of whether the virus is present. The viral culture test, while useful, is less commonly used today due to the superior sensitivity of PCR. Another diagnostic method is direct fluorescent antibody (DFA) testing, which involves applying a fluorescent dye to a sample of the lesion. This test can quickly confirm the presence of HSV by detecting viral proteins under a special microscope. However, the DFA test is not as commonly used as PCR provides a more thorough and accurate result. For individuals who are not experiencing active symptoms, or for those who wish to confirm a previous infection, a blood test is often the preferred diagnostic method. Blood tests look for antibodies to HSV, which the immune system produces in response to the virus. There are two types of antibodies the test may detect: IgM, which appears soon after infection, and IgG, which indicates past infection. The presence of IgG antibodies confirms that an individual has been exposed to HSV at some point, but it does not indicate whether the person is currently infected or experiencing an active outbreak. Blood tests can differentiate between HSV1 and HSV2, providing important information about the type of infection a person has. While blood tests can confirm a past infection, they are less useful for diagnosing an active outbreak, since the virus may not be present in the blood during such times. Additionally, blood tests may result in false positives or false negatives, especially in people who have a low viral load or have never experienced symptoms. Ultimately, the diagnostic approach for HSV will depend on the individual's symptoms and healthcare provider's guidance. Regardless of the method used, getting an accurate diagnosis is key to managing the infection, reducing its impact, and taking steps to prevent transmission to others. When and how to get tested. Getting tested for herpes simplex virus, HSV, is an important step in understanding one's health status, managing symptoms, and preventing transmission to others. It is essential to know when to seek testing and how to approach the process to ensure an accurate diagnosis. While not everyone needs to get tested, certain circumstances may warrant testing, especially if an individual suspects they have been exposed to the virus or experiences symptoms. Testing should be considered when an individual has symptoms consistent with HSV infection. Common signs of an outbreak include the appearance of sores or blisters in areas such as the mouth, lips, genitals, or anus. If these sores are painful, itchy, or accompanied by flu-like symptoms such as fever or swollen lymph nodes, it is important to seek medical advice. Even if symptoms are mild or the sores are in an unusual location, testing can provide clarity and guide treatment decisions. Testing is also recommended if a person has a known exposure to HSV through sexual contact with someone who has been diagnosed with the virus or has symptoms consistent with an outbreak. Additionally, individuals who have never had symptoms but wish to know their HSV status may consider testing. This is particularly relevant for individuals with multiple sexual partners or those who are planning to start a new relationship and want to discuss their sexual health openly with their partners. Some people may want to confirm whether they have been exposed to the virus without experiencing an outbreak, as HSV can be present in the body without causing symptoms. Blood tests can detect HSV antibodies, which indicate past exposure to the virus, even if there is no active infection. Testing should be done as soon as possible after noticing symptoms for the most accurate results. If testing occurs during an active outbreak, such as when visible sores are present, a swab test, viral culture, or PCR can directly detect the virus in the lesions. If symptoms are not present, a blood test to detect antibodies can be used, though it may take a few weeks for antibodies to appear after exposure. For those unsure of when to get tested, consulting a healthcare provider is an essential step. A provider can assess symptoms, potential risks, and offer guidance on whether testing is necessary. Testing for HSV is a straightforward process that can typically be done during a routine medical visit or at a specialized clinic. Whether swab tests or blood tests are used, obtaining a diagnosis is the first step toward effectively managing the infection and reducing the risk of transmission to others. Understanding results. Interpreting the results of herpes simplex virus, HSV testing, can be complex, as several factors influence the outcome. Whether a person receives a positive or negative result, understanding the meaning of the test results is essential for managing the infection and making informed decisions about health and treatment options. The results of HSV tests can vary depending on the type of test performed and the timing of the test in relation to the onset of symptoms. For those undergoing a swab test during an active outbreak, the results are relatively straightforward. A positive result indicates that the virus has been detected in the sample, confirming an HSV infection. The test will also identify whether the infection is caused by HSV1 or HSV2, providing important information about the type of virus. In cases where the test comes back negative despite visible sores, it may be due to improper sample collection or a test performed too late in the infection when the viral load is too low to detect. False negatives are more common in viral culture tests, as the virus may not be present in sufficient quantities at the time of testing. If a blood test is performed, the interpretation of results can be more nuanced. A positive result indicates the presence of antibodies to HSV, which means that the individual has been exposed to the virus at some point in their life. The presence of IgG antibodies suggests a past infection, while IgM antibodies indicate a recent or primary infection. It's important to note that a positive blood test does not necessarily mean the person is currently experiencing an outbreak. In many cases, individuals with a positive blood test for HSV have no symptoms or outbreaks at all. Blood tests cannot determine the location of the infection or if it is active, making them more useful for confirming past exposure rather than diagnosing current outbreaks. A negative blood test typically means that the person has not been exposed to the virus or that their immune system has not yet developed detectable levels of antibodies. However, negative results may occur if the test is performed too early after exposure, as it can take several weeks for antibodies to develop. In some cases, individuals who are asymptomatic may also test negative despite having the virus in their body. It is essential for individuals to discuss their test results with a healthcare provider who can explain the findings in context, offer further testing if needed, and help guide decisions regarding treatment, prevention, and transmission risk. Understanding HSV test results allows individuals to make informed choices about their health and manage the virus effectively. Chapter 3: Preventing Herpes Transmission. Preventing the transmission of herpes simplex virus, HSV, is a key aspect of managing the infection, both for individuals living with the virus and for their partners. While there is no cure for HSV, several strategies can significantly reduce the risk of spreading the virus to others. These methods focus on minimizing exposure, controlling outbreaks, and using appropriate preventive measures in daily life and sexual activity. The most effective way to prevent HSV transmission is to avoid direct contact with infected areas during an active outbreak. When visible sores or blisters are present, individuals should refrain from kissing, sexual activity, or touching the affected areas to reduce the risk of spreading the virus. Since HSV can also be transmitted even when no symptoms are visible, taking precautions during asymptomatic periods is essential. Asymptomatic shedding can occur, where the virus is active on the skin without causing noticeable sores. During these times, individuals may still unknowingly spread the virus, making it important to be cautious even when no visible symptoms are present. One of the most effective strategies for reducing transmission is the use of antiviral medications. These medications, which can be taken orally or applied topically, help to reduce the severity and frequency of outbreaks. When taken daily, suppressive antiviral therapy can significantly lower the likelihood of transmitting HSV to sexual partners, even during asymptomatic periods. For those with frequent outbreaks or those concerned about transmission, daily antiviral medication may be particularly helpful in reducing the spread of the virus. Barrier methods, such as condoms, are another essential tool in preventing the transmission of HSV, especially during sexual activity. While condoms do not eliminate the risk of transmission entirely, they significantly reduce it by covering the areas most likely to be infected. It is important to use condoms consistently and correctly, as even skin-to-skin contact in areas not covered by a condom can result in the transmission of HSV. Dental dams, which are used during oral sex, can also help reduce the risk of transmission during oral genital contact. Open communication between partners is crucial for preventing HSV transmission. Those with HSV should discuss their status honestly and openly, especially with sexual partners, to ensure mutual understanding and informed decision-making. Couples can then make decisions together about whether to use antiviral medications, condoms, or other preventive measures. In addition to sexual practices, individuals should avoid sharing personal items, such as towels, lip balm, or eating utensils, as the virus can be spread through contact with contaminated surfaces. Proper hygiene practices, such as frequent hand washing, can also help prevent the spread of the virus. By employing a combination of these preventive strategies, individuals with HSV can reduce the likelihood of transmitting the virus to others and take proactive steps to manage their condition and protect their partners. Preventative measures and safe practices. Implementing preventative measures and safe practices is essential for individuals with herpes simplex virus, HSV, to reduce the risk of transmission and protect their sexual partners and others in their environment. While it is not always possible to completely eliminate the risk of spreading HSV, taking steps to minimize exposure can significantly reduce the likelihood of transmission. These practices are crucial both during outbreaks and between outbreaks, as HSV can be transmitted even when no visible symptoms are present. One of the most important preventative measures is the use of antiviral medications. Daily suppressive therapy with antiviral drugs such as acyclovir, valacyclovir, or famciclovir can effectively reduce the frequency and severity of outbreaks and significantly lower the risk of transmission to sexual partners. Suppressive therapy has been shown to reduce asymptomatic shedding, the process where the virus is active on the skin without producing visible symptoms, which is one of the key ways HSV is spread even in the absence of sores. Individuals on suppressive therapy are much less likely to pass the virus to others compared to those who are not on medication. Condoms and other barrier methods are also vital in reducing the transmission of HSV during sexual activity. Using condoms consistently and correctly during vaginal, anal, and oral sex helps protect both partners from exposure to the virus. While condoms do not provide complete protection, they reduce the areas of skin-to-skin contact, which in turn decreases the risk of HSV transmission. Dental dams, which are used during oral sex, can also help prevent the spread of the virus during oral genital contact. It is important to note that HSV can still be transmitted from areas not covered by a condom or dental dam, such as the thighs, buttocks, or areas around the genital region. So while these methods reduce risk, they do not eliminate it entirely. In addition to sexual practices, individuals with HSV should avoid sharing personal items that may come into contact with infected areas, such as towels, razors, lip balm, or eating utensils. The virus can survive on surfaces for a short period, and sharing items that have come into contact with a lesion can lead to transmission. Proper hygiene practices, such as frequent hand washing, are also important, especially after touching an affected area, to prevent the spread of the virus to other parts of the body or to others. Lastly, open communication with sexual partners about HSV status is a key practice in preventing transmission. Honesty and mutual understanding are essential in making informed decisions about safe sexual practices and treatment options. Discussing HSV openly can help reduce misunderstandings and encourage both partners to take steps to protect themselves and each other. By integrating these preventive measures into daily life, individuals with HSV can significantly lower the risk of transmitting the virus, leading to better outcomes for both their own health and the health of their partners. Condom use and other barrier methods. Condoms and other barrier methods are essential tools in reducing the transmission of herpes simplex virus, HSV, particularly during sexual activity. While these methods do not completely eliminate the risk of transmission, they significantly decrease the likelihood of spreading the virus by reducing skin-to-skin contact, which is the primary mode of HSV transmission. Understanding the proper use of condoms and other barrier methods can help individuals with HSV protect their partners and reduce the risk of viral spread. Condoms are one of the most effective and widely recommended barrier methods for preventing HSV transmission during vaginal, anal, and oral sex. When used consistently and correctly, condoms provide a physical barrier that covers the genital area, reducing the likelihood of direct contact with infected skin or mucous membranes. While condoms do not cover all potential sites of infection, such as the thighs, buttocks, or areas around the genitals, they significantly lower the chances of transmission by covering the primary areas where HSV sores are likely to appear. In the case of genital herpes, using a condom during sexual activity, even when no symptoms are visible, greatly reduces the risk of spreading the virus to a partner. Latex condoms are the most commonly used and are highly effective in preventing the transmission of HSV. However, for individuals with latex allergies, alternative options such as polyurethane or polyisoprene condoms can be used. It is important to ensure that condoms are used throughout the entire duration of sexual activity, from start to finish, and that they are not damaged, as any breakage can increase the risk of transmission. For oral sex, dental dams are an effective barrier method for reducing the risk of transmitting HSV. A dental dam is a thin, flexible piece of latex or polyurethane that is placed over the genital area or anus during oral sex. Like condoms, dental dams help to prevent direct contact with sores or skin that may be shedding the virus, thereby reducing the likelihood of transmission. While dental dams are not as widely used as condoms, they offer an important layer of protection during oral genital or oral anal contact. In addition to condoms and dental dams, individuals with HSV can consider other protective measures to minimize the risk of transmission. For example, using lubricants can help reduce friction during sex, which may lower the risk of condom breakage or irritation. Water-based lubricants are typically recommended, as oil-based lubricants can weaken latex condoms and increase the risk of breakage. Ultimately, while no barrier method provides 100% protection, Using condoms and dental dams during sexual activity significantly reduces the risk of transmitting HSV. Consistent and correct use of these methods, combined with open communication with sexual partners and the use of antiviral medications, can help individuals with HSV lead healthy, fulfilling sexual lives while minimizing the risk of spreading the virus. Importance of communication with partners. Open and honest communication with partners is crucial in preventing the transmission of herpes simplex virus, HSV, and ensuring the well-being of both individuals in a relationship. Discussing HSV status, risks, and safe practices helps create a foundation of trust and mutual understanding, fostering healthier relationships and enabling both partners to make informed decisions about their sexual health. The conversation about HSV may feel uncomfortable or difficult, but it is necessary for both partners to have a clear understanding of the risks and preventive measures involved. For individuals living with HSV, it is important to communicate openly with potential or current partners about the virus. While this may be a sensitive topic, sharing this information empowers both individuals to take the necessary precautions to reduce the risk of transmission. Being transparent about one's HSV status shows respect for the partner's health and demonstrates a commitment to making responsible decisions regarding sexual activity. When both partners are aware of the risks and preventative options, they can mutually decide on the most appropriate course of action, whether that involves the use of condoms, antiviral medications, or abstaining from certain sexual activities during an outbreak. Communication also involves discussing the timing of testing and any previous exposure to HSV. If one partner has been tested for the virus, it may be helpful to share the results and any relevant information, such as whether they are experiencing symptoms or on suppressive therapy. This allows both partners to assess their risk level and consider any adjustments to their sexual practices. If one partner has not been tested, encouraging testing can be an important step in ensuring both individuals are informed about their health status. It's also crucial for individuals to be aware of the possibility of asymptomatic shedding, where the virus is active without visible sores, and to discuss how to handle such situations. In addition to the immediate risks of transmission, communication is also key to addressing the emotional aspects of living with HSV. A partner's response to learning about the virus can vary, and being prepared for different reactions can help ease any tension. It's important to approach the conversation with patience, empathy, and understanding, acknowledging that both partners may need time to process the information and adjust their perspectives. Ultimately, clear communication helps to reduce fear, misunderstanding, and stigma surrounding HSV. By openly discussing the virus and taking proactive steps to protect one another, couples can maintain a healthy, supportive relationship while minimizing the risk of HSV transmission. Reducing the risk of outbreaks. Reducing the risk of herpes simplex virus HSV outbreaks is an essential aspect of managing the infection, both for individuals living with the virus and their sexual partners. Although HSV outbreaks are influenced by a variety of factors, several strategies can help minimize their frequency and severity. These strategies focus on managing triggers, using antiviral medications, and maintaining a healthy lifestyle, all of which can contribute to better control over the virus and fewer disruptions caused by outbreaks. One of the most effective ways to reduce the risk of outbreaks is through the use of antiviral medications. Medications such as acyclovir, valacyclovir, and famciclovir help to suppress the virus by reducing its replication in the body. For those who experience frequent outbreaks, taking suppressive antiviral therapy on a daily basis can significantly decrease the number of occurrences and the duration of outbreaks. Suppressive therapy is especially beneficial in reducing the risk of transmitting the virus to others, as it lowers the amount of viral shedding, even when there are no visible symptoms. For individuals with occasional outbreaks, antiviral medications taken during an outbreak can also help shorten the duration and severity of symptoms. In addition to medication, Understanding and managing potential triggers is another key strategy for reducing the risk of outbreaks. Stress is one of the most common triggers for HSV flare-ups, as it can weaken the immune system and make the body more susceptible to viral reactivation. Practicing stress management techniques, such as meditation, yoga, deep breathing exercises, or engaging in enjoyable activities, can help reduce the frequency of outbreaks. Regular exercise and getting adequate sleep are also important for maintaining a healthy immune system, which can better suppress the virus and reduce flare-ups. Certain environmental factors, such as excessive sunlight or physical trauma to the skin, can also trigger outbreaks, particularly for individuals with oral herpes, HSV1. Wearing lip balm with sunscreen and protecting the lips from extreme temperatures or physical irritation can help prevent these types of outbreaks. Similarly, for those with genital herpes, HSV2, avoiding tight-fitting clothing or friction that irritates the skin can be helpful in minimizing triggers. Maintaining a balanced and healthy diet that supports immune function can also play a role in reducing outbreaks. Nutrients such as vitamin C, zinc, and lysine have been suggested to support the immune system and may help reduce the frequency of outbreaks. Avoiding triggers such as excessive alcohol consumption or smoking, both of which can impair the immune system, may also contribute to fewer flare-ups. By combining antiviral treatment, stress management, healthy lifestyle choices, and environmental precautions, individuals with HSV can significantly reduce the risk of outbreaks, leading to better control of the virus and an improved quality of life. Chapter 4. Managing herpes outbreaks. Managing herpes simplex virus, HSV, outbreaks is a crucial part of living with the virus, as these flare-ups can be uncomfortable and sometimes challenging to navigate. While there is no cure for HSV, effective management strategies can help reduce the duration, severity, and frequency of outbreaks. This chapter outlines the approaches individuals can take to manage an HSV outbreak, including antiviral treatments, self-care practices, and lifestyle adjustments. Antiviral medications are a cornerstone in managing herpes outbreaks. These drugs, including acyclovir, valacyclovir, and famciclovir, work by inhibiting the replication of the virus, reducing the severity of symptoms, and speeding up the healing process. For those experiencing their first outbreak or dealing with frequent recurrences, antiviral medication can be prescribed to treat the outbreak and shorten its duration. Additionally, individuals who have recurrent outbreaks may benefit from suppressive therapy, which involves taking antiviral medication on a daily basis to reduce the frequency of flare-ups and minimize asymptomatic viral shedding. Self-care practices are equally important in managing outbreaks and promoting comfort during flare-ups. During an outbreak, sores or blisters may cause pain, itching, or irritation. Applying cool compresses to the affected area can provide relief by reducing swelling and discomfort. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage pain and fever associated with outbreaks. Topical treatments, such as numbing creams containing lidocaine, can also provide localized relief from pain and itching. It's essential to keep the affected area clean and dry to avoid further irritation or secondary infections. Gentle washing with mild soap and water and avoiding scrubbing the sores will promote healing. In addition to pain relief, individuals should be mindful of their personal hygiene during an outbreak to prevent spreading the virus to other parts of the body or to others. Washing hands frequently and avoiding touching the sores, as well as refraining from sharing personal items such as towels or razors, are important steps in reducing the risk of transmission. Wearing loose, comfortable clothing can help avoid irritation on the affected area, especially for those with genital herpes. While antiviral medications and self-care techniques play a significant role in outbreak management, certain lifestyle changes can also help reduce the frequency of outbreaks. Stress management is a vital component, as stress is a known trigger for HSV flare-ups. Regular exercise, Adequate sleep and relaxation techniques can help maintain a healthy immune system, which in turn helps manage the virus. A balanced diet rich in vitamins and minerals that support immune function can also aid in managing outbreaks. Through a combination of medical treatments, self-care, and lifestyle adjustments, individuals with HSV can manage outbreaks more effectively, improving both their physical comfort and emotional well-being during flare-ups. Recognizing the signs of an outbreak. Recognizing the signs of a herpes simplex virus HSV outbreak early is essential for effective management and reducing the risk of transmission to others. HSV outbreaks typically follow a predictable pattern, with certain symptoms and sensations occurring before visible sores appear. Understanding these early warning signs can help individuals take proactive steps, such as starting antiviral treatment, practicing preventive measures, and seeking relief from discomfort. The first sign of an HSV outbreak often involves a tingling, itching, or burning sensation in the area where the outbreak is likely to occur. This sensation, known as prodrome, usually happens 24 to 48 hours before visible sores appear. For individuals with oral herpes HSV1, this may occur around the lips, mouth, or gums. For those with genital herpes HSV2, prodrome symptoms may be felt in the genital or anal area. The tingling or itching sensation is often described as a pins and needles feeling and can be a key indicator that an outbreak is imminent. As the outbreak progresses, small blisters or sores may form at the site of the prodrome symptoms. These blisters are filled with clear fluid and are often painful or uncomfortable. They may break open, releasing the fluid and leaving behind shallow, open sores. The affected area may also become swollen, red, or inflamed. In addition to the local symptoms, individuals may experience flu-like symptoms such as fever, swollen lymph nodes, headache, and muscle aches, particularly during the first outbreak or if the individual's immune system is compromised. In some cases, individuals with HSV may experience outbreaks without noticeable prodrome symptoms. These cases are more common for people with recurrent outbreaks, as they may have fewer visible signs or symptoms. However, even in the absence of visible sores, the virus can still be contagious, as asymptomatic shedding can occur. This is why it is important to remain vigilant and practice preventive measures consistently, even when symptoms are not apparent. For those who are familiar with their outbreak patterns, recognizing the early signs of an outbreak allows for timely intervention. Early treatment with antiviral medications can help reduce the severity and duration of the outbreak. If symptoms are caught early enough, the outbreak may be less severe and heal more quickly. Overall, recognizing the signs of an HSV outbreak early can help individuals manage their condition more effectively, minimize discomfort, and reduce the risk of transmission to others. Over-the-counter versus prescription medications. When managing herpes simplex virus, HSV, understanding the difference between over-the-counter, OTC, and prescription medications is crucial for effective treatment. Both types of medications play a role in alleviating symptoms, reducing the severity and duration of outbreaks, and managing the virus. However, they differ in their potency, application, and the types of outbreaks they are best suited for. Over-the-counter medications are commonly used to provide relief from the pain and discomfort associated with HSV outbreaks. These products typically include topical treatments, such as creams or ointments containing active ingredients like docosahexaene or lidocaine. Docosahexaene is an antiviral agent that can help shorten the duration of an outbreak if applied at the first sign of symptoms. It works by preventing the virus from entering healthy skin cells, thus reducing the spread of the infection. Lidocaine, a topical anesthetic, can numb the affected area, providing relief from pain, itching, and discomfort. While these OTC treatments can be effective in managing symptoms and promoting healing, they do not address the underlying viral infection and are not as powerful as prescription medications. Prescription medications, on the other hand, are typically more effective in treating the HSV virus itself. Antiviral drugs, such as acyclovir, valacyclovir, and famciclovir are commonly prescribed to manage outbreaks. These medications work by inhibiting the replication of the virus, which can shorten the duration of an outbreak, reduce the severity of symptoms, and prevent future outbreaks. Prescription antiviral medications are especially beneficial for individuals who experience frequent outbreaks or severe symptoms. For those with recurrent outbreaks, a healthcare provider may recommend suppressive therapy, which involves taking antiviral medication daily to prevent outbreaks from occurring and reduce the risk of transmitting the virus to others. The main advantage of prescription medications over OTC treatments is their ability to address the root cause of the infection. Antiviral prescription medications work systemically, meaning they circulate throughout the body and target the virus wherever it is located. This can result in faster and more comprehensive relief, especially for those with frequent or severe outbreaks. Additionally, prescription medications can help reduce asymptomatic viral shedding, which is the process where the virus is active on the skin without visible symptoms, lowering the likelihood of transmission to others. While OTC medications can be helpful for managing mild symptoms and supporting the healing process, prescription medications offer a more targeted and effective approach to controlling the virus and preventing future outbreaks. A healthcare provider can help determine the most appropriate treatment based on the frequency and severity of outbreaks, as well as the individual's overall health. Home remedies and lifestyle adjustments. In addition to antiviral medications, there are several home remedies and lifestyle adjustments that can help individuals manage herpes simplex virus, HSV outbreaks, reduce discomfort, and prevent future flare-ups. These approaches can complement medical treatments, promote overall health, and improve the quality of life for those living with HSV. One of the most commonly recommended home remedies for managing HSV outbreaks is the use of cool compresses. Applying a cool, damp cloth to the affected area can help soothe pain, reduce inflammation, and speed up the healing process. This is particularly useful during the early stages of an outbreak when sores are forming. Similarly, soaking in a warm bath with Epsom salts may help relieve pain and itching, while also promoting relaxation. However, it is important to avoid hot water or scrubbing the sores, as this can cause further irritation and delay healing. Certain natural oils and supplements have been suggested to help manage HSV symptoms. For example, lemon balm, Melissa officinalis, is known for its antiviral properties and can be applied topically to the affected area in the form of a cream or oil. Some people find that applying aloe vera gel to the sores helps reduce inflammation and provides relief from itching. Lysine, an amino acid found in foods like dairy products and fish, is believed to help suppress the replication of the HSV virus. Some individuals take lysine supplements to reduce the frequency and severity of outbreaks, although more research is needed to fully understand its effectiveness. In addition to these topical remedies, making certain lifestyle adjustments can play a significant role in managing HSV. Stress is one of the most common triggers for outbreaks, so managing stress through relaxation techniques such as deep breathing, meditation, yoga, or journaling can help reduce the frequency of flare-ups. Regular exercise is also important as it can improve immune function, reduce stress, and promote overall well-being. However, individuals with HSV should avoid overexertion, as excessive physical strain can sometimes trigger an outbreak. Maintaining a balanced diet rich in vitamins and minerals is another important factor in managing HSV. A healthy diet supports a strong immune system, which helps the body fight off the virus and reduce the risk of outbreaks. Foods that are high in antioxidants, such as fruits and vegetables, as well as those rich in zinc and vitamin C, are particularly beneficial for immune function. Limiting alcohol consumption and avoiding smoking can also help boost immune health and reduce the likelihood of outbreaks. Lastly, practicing good hygiene and taking measures to avoid skin irritation can prevent outbreaks from worsening. Keeping the affected area clean and dry, wearing loose-fitting clothing, and avoiding irritants like harsh soaps or chemicals can help promote healing and reduce discomfort. By combining home remedies, lifestyle adjustments, and medical treatments, individuals with HSV can better manage their condition, reduce the frequency of outbreaks, and improve their overall quality of life. Managing pain and discomfort. Managing the pain and discomfort associated with herpes simplex virus, HSV outbreaks is a vital part of improving quality of life for those affected by the virus. Outbreaks can cause significant physical discomfort, including painful sores, itching, and burning sensations. And addressing these symptoms effectively can help individuals feel more comfortable during flare-ups. A combination of medical treatments, home remedies, and self-care strategies can help alleviate pain and discomfort, providing relief and promoting faster healing. One of the most common methods for managing pain during an HSV outbreak is through the use of antiviral medications. Prescription antiviral drugs, such as acyclovir, valacyclovir, and famciclovir, not only reduce the duration and severity of the outbreak, but also help alleviate pain by limiting viral replication. These medications can significantly reduce the discomfort caused by active sores and prevent the development of additional lesions. For people with frequent outbreaks, suppressive antiviral therapy, which involves taking medication daily, can also help prevent pain and discomfort by reducing the frequency of flare-ups. Topical treatments are another useful option for managing pain and discomfort. Over-the-counter creams and ointments containing numbing agents like lidocaine or benzocaine can be applied directly to the affected area to numb the pain and reduce itching. These topical anesthetics provide temporary relief by blocking nerve signals in the affected area, allowing individuals to experience a more comfortable healing process. Additionally, creams containing ingredients such as docosahexaene or aloe vera can provide soothing effects that reduce inflammation and promote healing. For those experiencing pain and discomfort from genital herpes, HSV2, taking warm baths with Epsom salts or adding baking soda to the bath water can help soothe the affected area. A warm bath can reduce swelling and promote relaxation, while Epsom salts help with muscle relaxation and provide relief from the discomfort caused by irritated skin. However, it is essential to avoid hot water, which can worsen irritation, and to avoid using harsh soaps or products that may exacerbate the symptoms. In addition to topical treatments and medications, lifestyle adjustments can also play a role in managing pain. Wearing loose-fitting, comfortable clothing can help prevent friction and irritation on the affected area, reducing discomfort, especially for genital herpes. It's important to avoid tight clothing or anything that can put pressure on the sores during the healing process. For many individuals, stress management is an essential component of pain management. Stress can trigger outbreaks or worsen symptoms, so practicing relaxation techniques such as deep breathing, yoga, or mindfulness can help reduce both physical and emotional discomfort. Getting adequate sleep, staying hydrated, and maintaining a balanced diet also play important roles in overall well-being, helping to strengthen the immune system and support the body's ability to heal. Through a combination of medical treatment, home remedies, and self-care practices, individuals with HSV can effectively manage pain and discomfort during outbreaks, improving their comfort and accelerating the healing process. Tips for handling emotional and psychological impact. Living with herpes simplex virus, HSV, can be emotionally and psychologically challenging. The stigma surrounding the virus, combined with the physical discomfort of outbreaks, can lead to feelings of shame, anxiety, and isolation. It's important for individuals with HSV to acknowledge the emotional impact the virus can have and seek ways to manage these feelings effectively. By focusing on emotional well-being, individuals can navigate the psychological challenges of living with HSV and lead a fulfilling life. One of the first steps in managing the emotional impact of HSV is accepting the diagnosis. While it can be difficult to come to terms with having a chronic condition, Understanding that HSV is a common virus can help alleviate feelings of isolation. It's important to remember that millions of people worldwide live with HSV, and having the virus does not define a person's worth or identity. Recognizing that the virus is manageable and does not have to interfere with leading a healthy, active life can help reduce emotional distress. Open communication with loved ones and partners is another crucial aspect of managing the emotional impact. Having honest discussions about the virus can help reduce feelings of shame or secrecy, fostering a sense of support and understanding. For those in relationships, discussing the virus openly can promote trust, transparency, and mutual respect. Educating partners about the virus can also help alleviate concerns and ensure that both individuals are on the same page regarding prevention and management. Being proactive about discussing HSV in relationships can create a healthier and more supportive environment. Seeking professional support from a therapist or counselor can be incredibly beneficial for individuals struggling with the emotional impact of HSV. A therapist can provide a safe space to express feelings, explore sources of anxiety or shame, and develop coping strategies. Cognitive behavioral therapy, CBT, and other therapeutic approaches can help individuals address negative thought patterns, manage stress, and build resilience in the face of the virus. Joining support groups, either in person or online, can also provide a sense of community and belonging. Connecting with others who are experiencing similar challenges can help individuals feel less alone and gain valuable insights into managing both the emotional and physical aspects of HSV. Support groups can offer emotional encouragement, practical advice, and a platform for sharing experiences. Finally, self-care practices, including stress management, exercise, and mindfulness, are essential for emotional well-being. Regular physical activity, relaxation techniques, and maintaining a balanced lifestyle can help reduce anxiety and improve mood. Taking time to care for one's mental and emotional health is an important part of living well with HSV. By acknowledging the emotional and psychological impact of HSV and utilizing strategies such as acceptance, communication, therapy, and self-care, individuals can better navigate the challenges the virus presents and lead a fulfilling, empowered life. Chapter 5: Long-Term Strategies for Managing HSV. Living with herpes simplex virus, HSV, requires a long-term approach to managing the condition effectively. While there is no cure for HSV, with appropriate strategies, individuals can reduce the frequency of outbreaks, alleviate symptoms, and minimize the risk of transmission to others. Long-term management involves a combination of medical treatments, lifestyle adjustments, and emotional support to ensure that individuals can lead healthy and fulfilling lives. One of the most important components of long-term management is consistent antiviral treatment. For individuals with frequent outbreaks or those who are at higher risk of complications, healthcare providers may recommend suppressive therapy. Suppressive therapy involves taking antiviral medications daily to reduce the frequency of outbreaks, decrease viral shedding, and lower the risk of transmitting the virus to others. This treatment strategy can significantly improve quality of life by preventing recurrent outbreaks and minimizing the emotional and physical toll of HSV. In addition to antiviral medication, lifestyle adjustments can play a crucial role in managing HSV over the long term. Stress is one of the most common triggers for outbreaks, so finding effective ways to manage stress is essential. Regular physical activity, mindfulness practices such as yoga or meditation, and relaxation techniques like deep breathing can help reduce stress and improve overall well-being. Developing a healthy routine that includes sufficient rest, a balanced diet, and regular exercise is vital for supporting the immune system and reducing the risk of outbreaks. Maintaining a healthy immune system is another key strategy for long-term management of HSV. A strong immune system helps the body fight off the virus and reduces the likelihood of frequent or severe outbreaks. Eating a nutritious diet rich in vitamins and minerals particularly those that support immune function, such as vitamin C, zinc, and selenium, is important. Regular exercise and sufficient sleep also support immune health, as does avoiding smoking and excessive alcohol consumption, which can weaken the immune system. Communication and education are also critical long-term strategies for managing HSV. Educating yourself and your partners about the virus can help reduce stigma and promote open conversations about prevention, treatment, and safe practices. For those in relationships, maintaining clear communication about HSV can foster trust and understanding, which are essential for maintaining healthy relationships. Additionally, keeping a personal record of outbreaks, triggers, and symptoms can help individuals manage their condition more effectively over time. Lastly, ongoing emotional support is essential for individuals living with HSV. Joining support groups, seeking therapy, and connecting with others who understand the emotional challenges of living with HSV can provide a sense of community and reduce feelings of isolation. Developing coping mechanisms for dealing with the emotional impact of HSV, including self-compassion and mindfulness, can help individuals build resilience and manage stress more effectively. By combining medical treatments, lifestyle changes, emotional support, and education, individuals with HSV can implement long-term strategies that reduce the impact of the virus, enhance their quality of life, and promote overall health and well-being. Antiviral therapy. Antiviral therapy plays a crucial role in managing herpes simplex virus, HSV infections, particularly for individuals who experience frequent outbreaks or have a higher risk of complications. While there is no cure for HSV, antiviral medications can effectively reduce the severity and duration of outbreaks, prevent recurrent flare-ups, and decrease the risk of transmission to others. The two main goals of antiviral therapy are to alleviate symptoms during outbreaks and to suppress the virus to prevent future outbreaks. The most commonly prescribed antiviral medications for HSV are acyclovir, valacyclovir, and famciclovir. These medications work by inhibiting the replication of the virus, which reduces the spread of the infection and shortens the duration of outbreaks. Acyclovir is the most widely used antiviral medication, available in both oral and topical forms. Valacyclovir is a prodrug of acyclovir, meaning it is converted into acyclovir once in the body, offering greater bioavailability and convenience with fewer doses. Famciclovir is similar to valacyclovir in terms of effectiveness and dosing, but is considered less potent than acyclovir in some cases. For individuals with occasional outbreaks, antiviral therapy is often used as episodic treatment. This involves taking the medication at the first sign of an outbreak, such as tingling or itching, to help reduce the severity of symptoms and shorten the duration of the episode. When started early, antiviral medications can significantly reduce pain, accelerate healing, and prevent new lesions from forming. Episodic treatment is typically recommended for individuals who have infrequent outbreaks or mild symptoms. For those who experience frequent or severe outbreaks, suppressive antiviral therapy may be recommended. Suppressive therapy involves taking antiviral medication daily to prevent outbreaks from occurring. This long-term treatment strategy can reduce the frequency of flare-ups, lower the risk of transmitting the virus to sexual partners, and minimize the psychological and physical impact of living with HSV. Studies have shown that suppressive therapy can be highly effective in reducing recurrent outbreaks and viral shedding, particularly in individuals with genital herpes, HSV2. While antiviral medications are generally safe, they can have side effects, such as nausea, headaches, or gastrointestinal issues. Serious side effects are rare, but may include kidney problems, especially in individuals with pre-existing kidney conditions. Regular follow-up with a healthcare provider is essential to monitor for potential side effects and ensure the medication is working effectively. Overall, antiviral therapy is a cornerstone of HSV management. Whether used episodically or as suppressive therapy, these medications help reduce the frequency and severity of outbreaks, promote faster healing, and lower the risk of transmission, improving the quality of life for individuals living with HSV. Managing frequent outbreaks. For individuals who experience frequent herpes simplex virus (HSV) outbreaks, managing the condition becomes a critical aspect of daily life. Frequent outbreaks can be physically and emotionally challenging, affecting not only the individual's health, but also their self-esteem and relationships. Fortunately, with the right approach, individuals can reduce the frequency and severity of outbreaks, minimize discomfort, and maintain a higher quality of life. One of the most effective strategies for managing frequent outbreaks is suppressive antiviral therapy. This approach involves taking antiviral medications daily to suppress the virus, reducing the likelihood of future outbreaks. Medications such as acyclovir, valacyclovir, and famciclovir are commonly prescribed for this purpose. Suppressive therapy has been shown to reduce the frequency of outbreaks significantly, as well as decrease the transmission of the virus to sexual partners. For many people, daily antiviral medication can be a long-term solution that greatly reduces the physical and emotional burden of frequent outbreaks. In addition to antiviral therapy, identifying and managing triggers is essential for minimizing the frequency of outbreaks. Several factors can trigger an outbreak, including stress, illness, hormonal changes, and environmental factors. Stress, in particular, is one of the most common triggers for HSV flare-ups, so developing effective stress management strategies is crucial. Practices such as meditation, yoga, deep breathing exercises, and regular physical activity can help reduce stress levels and promote relaxation. Ensuring sufficient sleep and maintaining a balanced diet also support the body's immune system, reducing the likelihood of outbreaks. Another important aspect of managing frequent outbreaks is maintaining good personal hygiene. Keeping the affected area clean and dry can prevent irritation and the spread of the virus to other parts of the body or to others. Avoiding tight-fitting clothing and using mild, non-irritating soaps can help prevent friction and further discomfort during an outbreak. If sores occur, it is important to avoid scratching or touching them, as this can spread the virus and lead to secondary bacterial infections. Lifestyle changes can also have a positive impact on reducing outbreaks. Eating a healthy, balanced diet rich in vitamins and minerals supports immune health, which plays a critical role in managing HSV. Foods that are high in antioxidants, such as fruits and vegetables, as well as those rich in zinc, vitamin C, and lysine, may help strengthen the immune system and reduce the frequency of outbreaks. Limiting the intake of arginine-rich foods, such as chocolate, nuts, and seeds, may also be beneficial for some individuals, as high levels of arginine can potentially trigger outbreaks. For individuals with frequent outbreaks, seeking professional support and emotional care is also important. Frequent outbreaks can cause emotional distress, leading to feelings of isolation, anxiety, and depression. Talking to a healthcare provider or counselor can provide reassurance, help address the emotional impact of frequent outbreaks, and offer strategies to cope with the psychological challenges of living with HSV. By using a combination of suppressive antiviral therapy, lifestyle adjustments, and self-care practices, individuals with frequent outbreaks can manage their condition more effectively, reduce the occurrence of flare-ups, and enhance their overall well-being. Strengthening immune health. Strengthening immune health is a key strategy for managing herpes simplex virus, HSV, and reducing the frequency and severity of outbreaks. A robust immune system plays an essential role in controlling the virus, minimizing flare-ups, and supporting overall health. While there is no cure for HSV, adopting lifestyle practices that enhance immune function can significantly improve the body's ability to manage the virus and reduce the impact of outbreaks. One of the most fundamental ways to strengthen the immune system is through proper nutrition. A diet rich in vitamins, minerals, and antioxidants provides the body with the necessary nutrients to support immune function. Vitamin C, found in citrus fruits, berries, and leafy greens, is particularly important for immune health as it helps protect cells from oxidative stress and supports the production of white blood cells that fight infections. Zinc, present in foods like nuts, seeds, and legumes, is also essential for immune function and can help reduce the duration of HSV outbreaks. Additionally, vitamin E, which is found in nuts, seeds, and vegetable oils, is a powerful antioxidant that helps protect immune cells from damage. Incorporating foods rich in lysine, such as fish, poultry, and dairy products, may also help manage HSV. Lysine has been shown to inhibit the replication of the virus, reducing the likelihood of outbreaks. Conversely, reducing the intake of arginine-rich foods, such as chocolate, nuts, and seeds, may help some individuals, as arginine can potentially trigger outbreaks by promoting viral replication. A balanced, nutrient-dense diet that supports the immune system is vital for reducing the risk of frequent outbreaks and promoting overall well-being. Regular physical activity is another powerful tool for strengthening the immune system. Exercise helps improve circulation, which allows immune cells to travel more efficiently throughout the body. It also helps reduce stress, which is a known trigger for HSV outbreaks. Moderate, consistent exercise, such as walking, swimming, or cycling, can boost immune function and improve overall health. However, it's important to avoid overexertion, as intense or excessive exercise can temporarily suppress the immune system, making it more vulnerable to infections. Adequate sleep is essential for a healthy immune system. During sleep, the body repairs itself and produces immune cells that fight off infections. Chronic sleep deprivation can weaken the immune system, making the body less able to manage viral infections like HSV. Aiming for 7 to 9 hours of quality sleep each night allows the body to recover, regenerate, and strengthen immune defenses. Reducing stress is also crucial for supporting immune health. Chronic stress weakens the immune system and can trigger HSV outbreaks. Practicing stress reduction techniques such as deep breathing, meditation, yoga, or mindfulness can help lower cortisol levels, support emotional well-being, and reduce the likelihood of flare-ups. By focusing on nutrition, exercise, sleep, and stress management, individuals can strengthen their immune systems and improve their ability to manage HSV over the long term. A holistic approach to immune health not only reduces the frequency of outbreaks, but also enhances overall physical and emotional well-being. Diet and nutrition for herpes management. Diet and nutrition play a significant role in managing herpes simplex virus, HSV, and reducing the frequency and severity of outbreaks. A well-balanced diet that supports immune health can enhance the body's ability to control the virus and minimize flare-ups. While no specific food can cure HSV, certain dietary choices can help prevent outbreaks, reduce symptoms, and strengthen the immune system. A key component of managing HSV through diet is ensuring that the body receives sufficient vitamins and minerals that support immune function. Vitamin C, found in fruits such as oranges, strawberries, and kiwi, helps boost the immune system by promoting the production of white blood cells, which are essential for fighting infections. It also acts as an antioxidant, protecting immune cells from oxidative stress and damage. Incorporating a variety of colorful fruits and vegetables into the diet will provide a wide range of antioxidants that help the immune system and reduce inflammation. Zinc, a mineral found in foods like meat, shellfish, legumes, and seeds, is another essential nutrient for immune function. Zinc helps activate immune cells and supports the body's ability to respond to viral infections. Studies have shown that adequate zinc levels can reduce the severity and duration of outbreaks and promote faster healing. Additionally, zinc helps maintain the health of the skin and mucous membranes, which is particularly important for managing HSV-related lesions. Lysine, an amino acid found in foods like fish, poultry, dairy products, and legumes, has been shown to help reduce the frequency of outbreaks in some individuals with HSV. Lysine may inhibit the replication of the virus, making it an important part of a herpes management diet. On the other hand, foods that are high in arginine, such as chocolate, nuts, and seeds, may encourage viral replication and potentially trigger outbreaks. While not all individuals with HSV need to avoid arginine-rich foods, limiting their intake can be beneficial for some people. Maintaining a healthy gut is also an important aspect of managing HSV, as the gut plays a key role in immune function. Probiotic-rich foods such as yogurt, kefir, and fermented vegetables can help promote a healthy gut microbiome, which supports overall immune health. A healthy gut may help reduce inflammation in the body and support the immune system's ability to fight infections, including HSV. Finally, staying hydrated is essential for overall health and immune function. Drinking plenty of water helps maintain skin hydration, which can prevent irritation and discomfort during outbreaks. Proper hydration also supports the body's detoxification processes, helping it eliminate toxins and maintain a balanced immune response. By incorporating a nutrient-rich diet focused on immune support, individuals with HSV can enhance their body's ability to manage the virus, reduce the frequency of outbreaks, and improve overall health. While diet alone is not a cure for HSV, it can be a powerful tool in managing the condition effectively. Stress is one of the most common triggers for herpes simplex virus, HSV, outbreaks, making stress management an essential part of controlling the frequency and severity of flare-ups. Managing stress not only helps reduce the risk of outbreaks, but also promotes overall health and well-being. By incorporating effective stress reduction techniques into daily life, individuals can improve their emotional resilience, maintain a healthy immune system, and reduce the emotional impact of living with HSV. One of the most effective stress management techniques is mindfulness meditation. Mindfulness involves focusing on the present moment and acknowledging thoughts and feelings without judgment. By practicing mindfulness regularly, individuals can reduce the physiological effects of stress, such as elevated cortisol levels, and promote relaxation. Studies have shown that mindfulness meditation can lower stress, improve emotional well-being, and even enhance immune function, making it a valuable tool for managing HSV. Beginners can start with short, guided meditation sessions and gradually increase the duration as they become more comfortable with the practice. Breathing exercises are another powerful technique for reducing stress and promoting relaxation. Deep breathing exercises, such as diaphragmatic breathing or the 4-7-8 technique, help calm the nervous system by activating the parasympathetic nervous system, which is responsible for the body's relaxation response. These exercises involve inhaling deeply, holding the breath for a few seconds, and exhaling slowly, which helps lower heart rate and reduce tension in the body. Incorporating deep breathing into daily routines, especially during moments of stress or anxiety, can provide immediate relief and improve long-term stress management. Physical activity is an excellent way to reduce stress and support overall mental health. Exercise increases the production of endorphins, the body's natural feel-good hormones, which help alleviate stress and boost mood. Regular exercise, such as walking, jogging, swimming, or yoga, can help individuals release built-up tension, improve sleep, and reduce anxiety. In addition to its physical benefits, exercise provides a sense of accomplishment and control, which can be empowering for individuals dealing with the emotional challenges of living with HSV. Yoga and Tai Chi are mind-body practices that combine physical movement, controlled breathing, and meditation. These practices help reduce stress, increase flexibility, and promote a sense of calm. Both yoga and Tai Chi emphasize mindfulness and deep relaxation, making them ideal for individuals looking to manage stress while improving physical health. Regular participation in these practices can help individuals achieve a balanced, peaceful state of mind and enhance their overall resilience to stress. Social support is also a key component of stress management. Building strong relationships with friends, family, or support groups can provide emotional reassurance and reduce feelings of isolation. Sharing experiences with others who understand the challenges of living with HSV can foster a sense of community and help individuals feel less alone. Regular social interactions and open communication with trusted individuals can buffer the effects of stress and improve emotional well-being. By incorporating these stress management techniques into daily life, individuals with HSV can effectively reduce stress, minimize the risk of outbreaks, and improve both their mental and physical health. Managing stress is a critical aspect of long-term herpes management, contributing to overall wellness and emotional balance. Chapter 6: Herpes and Relationships. Herpes simplex virus, HSV, can have a significant impact on relationships, particularly in romantic and intimate contexts. The stigma surrounding herpes, coupled with the emotional and physical challenges it presents, can create anxiety and uncertainty for individuals living with the virus. However, with open communication, understanding, and proper management, individuals with HSV can maintain healthy, fulfilling relationships. One of the most important aspects of navigating relationships with herpes is honesty. Open, clear communication with a partner about the diagnosis is crucial. While this conversation can be uncomfortable or anxiety-inducing, it is necessary to ensure that both partners are informed, understand the risks involved, and can make decisions together about how to proceed. Discussing herpes early in the relationship fosters trust and allows both individuals to express concerns and set boundaries. It also provides the opportunity to educate the partner about HSV, addressing any misconceptions, and emphasizing that herpes is manageable and does not define the relationship. For individuals with HSV, it's important to remember that the virus does not diminish their worth or the potential for a loving, intimate partnership. Educating both oneself and the partner about the virus, its transmission risks, and how to manage outbreaks can alleviate much of the anxiety associated with the diagnosis. Couples can take proactive steps to minimize transmission risk, such as using antiviral medications, practicing safe sex with barrier methods like condoms, and avoiding intimate contact during outbreaks. The emotional impact of HSV on relationships can be significant, especially when dealing with feelings of guilt, shame, or fear of rejection. It's essential to address these emotions and engage in self-care to manage mental health. Seeking support from a therapist, counselor, or support group can help individuals navigate the emotional challenges of living with HSV and foster a healthier mindset about the virus. Additionally, discussing feelings with a partner in an open and non-judgmental manner helps to maintain emotional connection and reduces feelings of isolation. Physical intimacy is a critical aspect of many relationships, and it is natural to worry about how HSV might affect sexual interactions. However, many couples find ways to maintain a satisfying sex life while managing HSV. By practicing safer sex, using antiviral therapy, and respecting each other's boundaries, couples can have a fulfilling and healthy sexual relationship. Emotional intimacy, trust, and open communication can further strengthen the connection, ensuring that HSV does not become a barrier to a happy, supportive partnership. Ultimately, managing herpes in a relationship involves balancing physical health with emotional connection, education, and mutual respect. By fostering open communication and a supportive environment, individuals with HSV can maintain strong, loving relationships while managing the virus. Open communication with partners. Open communication is vital for maintaining a healthy relationship when one partner has herpes simplex virus, HSV. The fear of rejection, judgment, or misunderstanding can make it difficult for individuals with HSV to share their diagnosis. However, honest and open dialogue is essential for building trust, ensuring both partners are informed, and making shared decisions about managing the virus within the relationship. Effective communication not only reduces anxiety, but also creates a space where both partners can openly discuss concerns and feelings, promoting a stronger emotional connection. The initial conversation about HSV can be challenging, but it is important to approach it with clarity and empathy. It's crucial to choose a calm, private moment to talk about the virus, explaining what HSV is, how it is transmitted, and the steps being taken to manage it. Providing accurate information about HSV, such as the fact that it is a common virus, the possibility of asymptomatic shedding, and the use of medications to reduce transmission risks, can help alleviate misconceptions and reduce fear. By addressing the issue directly and without shame, individuals can set the stage for an open and supportive discussion. One of the key elements of open communication is vulnerability. Sharing personal feelings, such as fear of rejection or shame, can help both partners understand each other's emotional states and foster mutual support. It's important to express how the virus impacts one's life and what steps are being taken to manage it, whether it involves medication, lifestyle changes, or seeking emotional support. This kind of openness allows both partners to express their own feelings and concerns, ensuring that both parties are heard and understood. Another important aspect of communication is ongoing dialogue. As relationships evolve, so too do the dynamics of managing HSV. Regular check-ins about how both partners are feeling emotionally and physically can help maintain transparency and address any new concerns. If the partner without HSV has questions or concerns, it's essential to approach them with empathy and provide reassurance. Similarly, both partners should feel comfortable discussing their boundaries regarding intimacy and sexual health, including when and how to engage in sexual activity, and whether protective measures like condoms or antiviral medication should be used. Open communication is also about maintaining respect for each other's emotional well-being. Partners should work together to create a safe, non-judgmental environment where both individuals feel supported. When both partners feel heard, informed, and cared for, the relationship is more likely to remain strong and resilient, despite the challenges that HSV may present. Ultimately, transparent communication not only helps manage the virus, but also strengthens the emotional bond between partners, promoting a healthy and fulfilling relationship. Navigating intimacy and herpes. Navigating intimacy while living with herpes simplex virus, HSV, requires open communication, trust, and understanding. Many people with HSV may worry that the virus will create barriers in their intimate relationships, leading to feelings of fear, shame, or anxiety. However, with proper management, education, and mutual respect, intimacy can still be a fulfilling and enjoyable aspect of a relationship. The first step in navigating intimacy with HSV is establishing open and honest communication with your partner. Sharing the diagnosis with a partner, though sometimes uncomfortable, is essential for transparency and informed decision-making. It is important to discuss the risks of transmission, the possibility of asymptomatic shedding, and how both partners can take steps to minimize the chances of spreading the virus. This conversation should emphasize that while HSV is a lifelong virus, it is manageable, and that having the virus does not define the value or potential of the relationship. One key way to reduce the risk of transmitting HSV during intimacy is through the use of barrier methods, such as condoms or dental dams. These methods provide a physical barrier that can help prevent the spread of the virus, particularly during vaginal, anal, or oral sex. While condoms do not offer 100% protection against HSV, they significantly reduce the risk of transmission when used consistently and correctly. Additionally, during outbreaks or when symptoms are present, it is important to avoid intimate contact to prevent spreading the virus to a partner. Another important aspect of navigating intimacy with HSV is understanding the role of antiviral medications. Many individuals with HSV take daily antiviral medications to reduce the frequency and severity of outbreaks, as well as to lower the risk of transmitting the virus to a partner. By discussing antiviral therapy with your healthcare provider and considering it as part of your relationship's management plan, both partners can feel more confident in their ability to navigate intimacy safely. It is also important to remember that intimacy is not limited to physical or sexual experiences. Emotional intimacy, trust, and closeness are foundational to a strong relationship. Being able to share vulnerabilities, such as concerns about transmission or managing outbreaks, can deepen the emotional bond and strengthen the relationship. Additionally, finding new ways to express affection and connection, such as through non-sexual touch, quality time, and emotional support, can help maintain a fulfilling relationship. Navigating intimacy with HSV requires mutual understanding, respect for boundaries, and a commitment to health and safety. While the virus may present challenges, it does not have to diminish the quality of relationships. With open communication, appropriate precautions, and emotional support, intimacy can continue to thrive. Coping strategies for partners. When one partner is diagnosed with herpes simplex virus, HSV, the other partner may experience a range of emotions, including confusion, fear, guilt, or even anger. It's important for both partners to acknowledge and address these feelings to ensure that the relationship remains strong and supportive. Coping strategies for partners are crucial in managing the emotional, physical, and psychological aspects of living with HSV. By adopting healthy coping mechanisms, both partners can navigate the challenges posed by the virus and maintain a fulfilling, supportive relationship. One of the most important strategies for partners is to educate themselves about HSV. Understanding the virus, its transmission methods, symptoms, and treatment options can reduce anxiety and help dispel common myths and misconceptions. With accurate knowledge, the partner without HSV is better equipped to make informed decisions about their health, communicate their concerns, and support their partner. Additionally, knowing that HSV is common and manageable can help reduce feelings of isolation or shame, enabling both partners to approach the situation more calmly and constructively. Emotional support plays a critical role in coping with HSV. The partner without the virus should be supportive and understanding, offering reassurance when needed, and validating their partner's emotions. Acknowledging that living with HSV may involve occasional outbreaks, feelings of frustration, or concerns about the future can create an atmosphere of empathy and compassion. It's important to remind each other that HSV does not define either partner, and that a successful relationship is built on mutual love, trust, and respect, not on the presence of a virus. Another helpful coping strategy is to maintain open and honest communication. This involves discussing the emotional impact of HSV, as well as addressing practical concerns such as sexual activity, protection, and outbreak management. Being able to openly express worries, boundaries, and preferences can help reduce misunderstandings and strengthen the partnership. These conversations should be ongoing, as the needs and feelings of both partners may evolve over time. It's also important for the partner without HSV to take care of their own mental health. Dealing with the emotional strain of a partner's diagnosis can be challenging, and it's okay to seek support from a counselor, therapist, or support group. Talking to others who are going through similar experiences can provide validation and emotional relief. Additionally, practicing self-care and stress management techniques, such as exercise, relaxation, and hobbies, can help maintain emotional balance and resilience. Finally, maintaining physical intimacy while managing HSV may require some adjustments, but it is possible. The partner without HSV should feel comfortable discussing their needs and desires, as well as expressing any fears about transmission. By working together, partners can navigate intimacy in a way that respects both individuals' health and emotional needs. Ultimately, coping with HSV as a partner involves mutual understanding, clear communication, and emotional support. With the right strategies, both partners can continue to build a strong and loving relationship while managing the challenges that HSV may bring. Support systems and counseling. Living with herpes simplex virus, HSV, can be an emotionally challenging experience, not only for the individual diagnosed with the virus, but also for their partner and loved ones. Having access to support systems and professional counseling can make a significant difference in managing the emotional and psychological impact of HSV. Support networks and counseling offer valuable resources for coping with stigma, improving emotional well-being, and navigating the complexities of relationships affected by the virus. One of the most important support systems is the network of family and friends. While sharing a diagnosis of HSV with close family and friends can be daunting, having a supportive group of people who can listen without judgment can help reduce feelings of isolation and shame. These trusted individuals can provide emotional reassurance, offer practical help, and remind the person with HSV that they are still loved and valued. Educating family and friends about the virus can also alleviate misconceptions and reduce stigmatization, helping them understand that HSV is common and manageable. In addition to personal support systems, seeking professional counseling can be incredibly beneficial. A therapist or counselor who specializes in sexual health, relationships, or chronic illness can provide guidance on how to cope with the emotional challenges of living with HSV. Therapy can help individuals and couples process their feelings of fear, guilt, anxiety, or anger, providing a safe space to discuss these emotions without judgment. Counseling can also help both partners address concerns about intimacy, communication, and trust, ensuring that the relationship remains strong and supportive. For individuals living with HSV, group therapy or support groups can be particularly helpful. Connecting with others who are going through similar experiences can provide a sense of solidarity and validation. Hearing others' stories, sharing coping strategies, and offering mutual encouragement can help individuals feel less alone in their journey. Many support groups, both online and in person, are led by trained professionals who can guide discussions and provide helpful resources. Sexual health clinics or support organizations dedicated to managing sexually transmitted infections, STIs, often offer counseling and resources for individuals affected by HSV. These services may include information about managing outbreaks, reducing transmission risk, and maintaining sexual health. These resources can help individuals and couples navigate their concerns about intimacy while living with HSV. Additionally, support for partners is crucial. Many counselors or support groups offer services specifically designed for partners of individuals with HSV. These resources help partners manage their emotions, address concerns about transmission, and maintain a healthy, supportive relationship. Couples counseling can help both partners learn to communicate openly about their needs, fears, and boundaries, strengthening their connection and resilience as a team. Ultimately, support systems and counseling are essential for maintaining emotional health, fostering resilience, and navigating the challenges of living with HSV. By accessing these resources, individuals and couples can create a supportive environment where they can cope with the emotional impact of HSV while continuing to thrive in their relationships and personal lives. Chapter 7: Myths and Misunderstandings about Herpes. Herpes simplex virus, HSV, is often surrounded by myths and misconceptions that can contribute to stigma, fear, and misinformation. These misunderstandings can affect the way individuals perceive the virus, as well as how they are treated by others. Clearing up these myths is crucial for reducing the shame and isolation often associated with HSV, as well as for fostering a more informed and compassionate approach to the condition. One of the most common myths about herpes is that it only affects individuals who are promiscuous or irresponsible. In reality, HSV is extremely common and can affect anyone, regardless of their sexual activity. It is estimated that more than half of adults worldwide have been exposed to HSV-1, and a significant percentage have been exposed to HSV-2. The virus can be transmitted through skin-to-skin contact, and many individuals contract it during childhood or adolescence, often without ever realizing it. Another prevalent myth is that herpes is a rare or serious disease. While HSV is a lifelong infection, it is generally manageable with appropriate treatment and lifestyle adjustments. Most people with HSV experience mild or occasional outbreaks, and many are asymptomatic or unaware of their infection. With antiviral medications, individuals can reduce the frequency and severity of outbreaks, and the risk of transmission to others can be minimized. Herpes is rarely life-threatening, And with proper care, most individuals with the virus can live normal, healthy lives. There is also a misconception that herpes always causes noticeable symptoms, such as painful sores or blisters. However, many individuals with HSV do not experience visible symptoms or have very mild symptoms that go unnoticed. This is particularly true for individuals with HSV-1, which often causes oral herpes, cold sores, but can also cause genital herpes. Because the virus can be asymptomatic or present with minimal symptoms, it is possible to unknowingly spread the virus to others. A further myth is that HSV is only transmitted during outbreaks. While the risk of transmission is highest when sores or blisters are present, it is still possible to transmit the virus when there are no visible symptoms through a process known as asymptomatic shedding. This is one reason why consistent use of antiviral medications and barrier methods like condoms is recommended for reducing the risk of transmission. Finally, there is the misconception that having herpes makes someone dirty or less than. This stigma is not only harmful, but also untrue. Herpes is a common viral infection that does not define a person's worth. People with HSV can have healthy, fulfilling relationships, maintain emotional well-being, and lead successful lives. Addressing the myths surrounding herpes and fostering open, non-judgmental conversations can help reduce stigma and encourage individuals to seek the support and treatment they need. By understanding the truth about HSV and dispelling myths, individuals can feel empowered to manage their health and relationships without the burden of misinformation and stigma. Common misconceptions about HSV. There are numerous misconceptions about herpes simplex virus, HSV, that contribute to fear, shame, and misunderstanding. These myths can make it difficult for individuals with the virus to openly discuss their condition, seek help, and maintain healthy relationships. Addressing these misconceptions is essential to creating a more informed and compassionate understanding of HSV. One of the most common misconceptions is that herpes is only transmitted through sexual contact. While sexual activity is a common route of transmission, HSV can also be spread through casual contact, such as kissing or sharing personal items like towels or razors. HSV-1, which typically causes oral herpes, can be transmitted through kissing, while HSV-2, which primarily causes genital herpes, can also be transmitted via non-sexual skin-to-skin contact. Many individuals are unaware that they can contract or transmit HSV without engaging in sexual activity. Another widespread misconception is that herpes always causes visible outbreaks. Many people believe that if someone has herpes, they will always show symptoms such as painful sores or blisters. However, this is not the case. A large number of individuals with HSV may never experience noticeable symptoms or may have mild, infrequent outbreaks that go unnoticed. In fact, many people with HSV are asymptomatic or have such mild symptoms that they are unaware they carry the virus, unknowingly transmitting it to others. There is also a pervasive myth that herpes is a rare or unusual condition. In reality, HSV is extremely common, with an estimated 2/3 of people worldwide being infected with HSV-1 and millions of people living with HSV-2. Both types of the virus are widespread, and many individuals may contract HSV during childhood or adolescence, often without symptoms. The misconception that herpes is rare or exceptional can contribute to feelings of isolation and stigma for those affected. Some people mistakenly believe that having herpes is a sign of promiscuity or poor hygiene. This idea perpetuates the stigma surrounding the virus and can cause individuals to feel ashamed or embarrassed about their diagnosis. However, HSV is a virus that can affect anyone, regardless of their sexual history or hygiene practices. The reality is that many people with HSV may have contracted it in ways that have nothing to do with their behavior, such as from a partner who was unaware they had the virus. Lastly, a common misconception is that herpes is not manageable or treatable. While there is no cure for HSV, the virus can be managed effectively with antiviral medications. These medications help reduce the severity and frequency of outbreaks, as well as lower the risk of transmission to others. By following a proper treatment plan and making lifestyle adjustments, individuals with HSV can lead healthy, fulfilling lives. By dispelling these common misconceptions about HSV, individuals can gain a more accurate understanding of the virus, reduce the stigma associated with it, and take the necessary steps to manage their health and well-being. Debunking stigma and social taboos. Herpes simplex virus, HSV, is one of the most stigmatized viral infections, largely due to misinformation, social taboos, and misconceptions about its transmission and impact. This stigma can affect not only individuals diagnosed with HSV, but also their relationships, mental health, and overall well-being. Debunking the stigma surrounding herpes is a critical step in promoting understanding, compassion, and healthier conversations about the virus. One of the key factors contributing to the stigma surrounding HSV is the misconception that it is a sign of promiscuity or moral failing. This notion stems from the idea that herpes is primarily spread through sexual activity, often creating an unjust association with immoral behavior. However, HSV can be transmitted through casual contact as well, and many people acquire the virus without engaging in high-risk behaviors. The reality is that herpes is a common virus, and anyone, regardless of sexual history, can contract it. This widespread misconception fuels feelings of shame and guilt for those with the virus and perpetuates the harmful stigma. The stigma surrounding HSV is also intensified by the taboo of discussing sexual health and sexually transmitted infections, STIs, openly. Many individuals with herpes are afraid to share their diagnosis with partners, friends, or family due to fear of judgment or rejection. This silence only perpetuates misinformation and reinforces the social taboo of discussing STIs. By normalizing conversations about herpes and other STIs, individuals can begin to break down these barriers and feel empowered to seek treatment, support, and education. Open dialogue helps to reduce the shame associated with these conditions and fosters understanding and empathy. Additionally, the visible symptoms of herpes, such as sores or blisters, can contribute to embarrassment and a sense of isolation. People with visible outbreaks may feel self-conscious about their appearance or worry that others will judge them. However, not everyone with HSV experiences visible outbreaks, and many people with the virus are asymptomatic. Reducing the focus on visible symptoms and reframing HSV as a manageable health condition rather than something to be ashamed of can help alleviate unnecessary distress. Another critical point in debunking the stigma is recognizing that having HSV does not define a person's worth. People living with herpes can lead successful, happy, and fulfilling lives. They can have healthy relationships, achieve personal goals, and contribute to society in meaningful ways. The stigma around herpes is not a reflection of the virus itself, but of societal discomfort with discussing sexual health openly. By challenging these stigmas and reframing HSV as a common and manageable condition, society can create an environment of acceptance and support. Ultimately, debunking the stigma surrounding herpes requires a collective effort to educate, normalize conversations about sexual health, and promote empathy for those living with the virus. By shifting perspectives and challenging societal taboos, we can create a more informed, compassionate, and supportive environment for individuals affected by HSV. Reframing herpes, educating and empowering individuals. Reframing herpes requires a shift in the way we think about and discuss herpes simplex virus HSV. Education and empowerment are key to breaking down the stigma and fostering a healthier, more supportive approach to managing and living with the virus. By understanding the virus, its transmission, and its impact, individuals can take control of their health, make informed decisions, and communicate more effectively with partners and healthcare providers. One of the first steps in reframing herpes is providing accurate, evidence-based information. The more individuals understand the science behind HSV, the less likely they are to be swayed by myths and misconceptions. HSV is a common virus that affects a significant portion of the population, and its transmission is not always linked to promiscuity or irresponsible behavior. Educating people about the various ways herpes can be contracted, the fact that many people are asymptomatic, and that it is a manageable condition helps to dispel harmful stereotypes and reduce fear. Education also plays a crucial role in helping individuals feel empowered to seek the appropriate treatment. Knowing that herpes can be managed with antiviral medications and that there are lifestyle changes that can help reduce outbreaks can instill a sense of control. Empowered individuals are more likely to adhere to treatment plans, make healthy choices, and seek support when needed. This sense of control can help combat feelings of helplessness and reduce the emotional burden that often accompanies a diagnosis of HSV. Empowering individuals also involves helping them communicate openly and confidently about their diagnosis. This is particularly important in relationships, where sharing an HSV diagnosis can be difficult. When individuals have accurate knowledge about the virus, they can approach their partner with understanding and a plan for reducing the risk of transmission. Open, honest communication about sexual health is essential to maintaining trust and intimacy in relationships. By reframing herpes as a health condition that can be managed rather than a source of shame, individuals can approach conversations with partners in a way that is clear, respectful, and solution-oriented. Furthermore, reframing herpes involves encouraging people to focus on their overall health and well-being. It is important to remember that herpes does not define a person's value or limit their potential. By focusing on holistic health, through diet, exercise, stress management, and emotional well-being, individuals can improve their immune system and overall quality of life, which can positively impact the frequency and severity of outbreaks. In sum, reframing herpes through education and empowerment allows individuals to move past the stigma and take control of their health. By fostering an informed and supportive environment, individuals can live fulfilling lives, maintain healthy relationships, and reduce the emotional and physical impact of HSV. Chapter 8: Herpes in Special Populations. Herpes simplex virus HSV can affect a wide range of individuals across various demographics. However, certain populations may experience unique challenges when managing HSV due to specific health conditions, life stages, or circumstances. Understanding how HSV impacts these groups can help ensure they receive appropriate care and support and that they are empowered to manage their condition effectively. One special population that requires particular attention is individuals with compromised immune systems, such as those living with HIV/AIDS, cancer, or autoimmune diseases. These individuals are at an increased risk of severe outbreaks and complications related to HSV, as their immune systems may not be able to suppress the virus as effectively. For people with HIV, for example, HSV infections can be more frequent, severe, and harder to manage. It is essential for individuals in these groups to work closely with their healthcare providers to develop an effective antiviral treatment plan that can help reduce the risk of outbreaks and manage the symptoms. Pregnant women are another population for whom HSV requires careful consideration. If a pregnant woman contracts HSV for the first time during pregnancy or has an active outbreak near delivery, there is a risk of transmitting the virus to the baby, which can lead to serious health complications for the newborn. Pregnant women with a history of HSV or who experience outbreaks during pregnancy should inform their healthcare providers early on to ensure that appropriate measures, such as antiviral medications or a cesarean delivery, can be taken to protect the baby. Proper prenatal care and early detection of any outbreaks are crucial in reducing the risk of neonatal herpes. Adolescents and young adults may also face unique challenges when managing HSV. This age group is often navigating the complexities of relationships, sexual health, and social pressures, which can make discussing HSV more difficult. The stigma associated with herpes can be especially impactful during this life stage, leading to feelings of isolation or anxiety. Education, Open communication with healthcare providers and peer support are essential in helping young people understand that HSV is a common and manageable condition. Normalizing these conversations can help alleviate the emotional burden that often accompanies a diagnosis. Finally, people in long-term relationships or those who are newly entering relationships may face specific challenges when one partner has HSV. Open and honest communication is key to managing HSV in these relationships. Couples need to discuss ways to reduce the risk of transmission, such as using antiviral medications or barrier methods, and establish trust and understanding regarding the virus. By approaching the situation with empathy and respect, couples can navigate the challenges of HSV while maintaining intimacy and emotional connection. In conclusion, herpes can affect different populations in varied ways, but with the right information and support, individuals in these groups can manage the virus effectively and continue to lead fulfilling lives. Tailoring care and support to the specific needs of these populations is essential for improving both their physical and emotional well-being. Herpes in pregnancy and its risks. Herpes simplex virus, HSV, can present unique challenges during pregnancy, requiring careful management to protect both the mother and the baby. The primary concern is the potential for transmitting the virus to the newborn, which can lead to neonatal herpes, a rare but serious condition. Understanding the risks and necessary precautions is essential for pregnant women with HSV or those who may be newly exposed to the virus during pregnancy. There are two main scenarios in which herpes may pose a risk to pregnancy. The first is when a woman who has a history of HSV experiences an outbreak during pregnancy. For those with a known history of herpes, the risk of transmitting the virus to the baby is lower if the mother has had the virus for a long time and her immune system has developed some level of protection. In these cases, antiviral medication can be prescribed, particularly in the third trimester, to reduce the likelihood of an outbreak at the time of delivery. If an outbreak occurs during labor, or if the mother has active genital sores, a cesarean section may be recommended to prevent direct contact between the baby and the virus. The second risk occurs when a pregnant woman contracts HSV for the first time during pregnancy. This situation is more concerning as the mother's immune system has not had the time to develop antibodies to the virus, leaving the baby vulnerable. The risk of transmitting the virus to the baby is highest during the first trimester or if the woman has an active outbreak near delivery. In such cases, antiviral medications may be prescribed to reduce the risk of an outbreak, and careful monitoring will be needed throughout the pregnancy. If the infection is detected close to delivery, a cesarean section is often recommended to minimize the risk of transmission. Neonatal herpes is a serious condition that can result in severe complications for the baby, including skin, eye, or mouth infections, and in more severe cases, brain damage or death. However, the incidence of neonatal herpes is relatively low, and with proper medical care, the risk can be minimized. Pregnant women who have a history of HSV or are concerned about possible exposure should communicate openly with their healthcare provider. Regular prenatal checkups, testing, and proactive management, including antiviral medications, can help ensure the best possible outcome for both mother and baby. In conclusion, while herpes during pregnancy does carry some risks, these risks can be effectively managed with medical intervention. By discussing concerns with healthcare providers and following a tailored treatment plan, women with HSV can reduce the chances of transmitting the virus to their babies and enjoy a healthy pregnancy. HSV in children and adolescents. Herpes simplex virus HSV can affect children and adolescents, presenting unique challenges for both physical and emotional well-being. While HSV is often associated with adults, children, especially infants and young children, can also contract the virus. Understanding the risks, symptoms, and management strategies for HSV in this population is crucial to ensuring proper care and minimizing complications. In infants, HSV can be acquired during childbirth, particularly if the mother has an active outbreak of genital herpes. Neonatal herpes, while rare, can be very serious, potentially leading to severe infections like encephalitis, brain infection, or systemic involvement. The virus can be transmitted during delivery if the infant comes into contact with the virus in the birth canal. However, it is important to note that most babies born to mothers with a history of HSV do not contract the virus, particularly if the mother has been treated with antiviral medications during the pregnancy or has no active outbreak at the time of delivery. Neonatal herpes is more likely if the mother contracts HSV for the first time during pregnancy, as her immune system has not had time to build up protective antibodies. In older children and adolescents, HSV infections are typically acquired through direct skin-to-skin contact, such as through kissing or sharing personal items like towels or eating utensils. HSV-1 is the most common cause of oral herpes in this age group, often manifesting as cold sores or fever blisters around the mouth. HSV-2, which is typically associated with genital herpes, can also affect children in some cases, though it is less common in younger populations. Symptoms in children and adolescents may include painful blisters, itching, and general flu-like symptoms such as fever and swollen lymph nodes. The emotional and psychological impact of HSV can be significant for adolescents. During a time of life when appearance, peer relationships, and self-esteem are particularly sensitive, children and teens may feel embarrassed or isolated due to visible outbreaks. It is important for caregivers and healthcare providers to provide emotional support and help adolescents understand that HSV is a common and manageable condition. Encouraging open discussions about the virus can help normalize the experience and reduce the stigma. Managing HSV in children and adolescents typically involves antiviral medications to reduce the severity and duration of outbreaks, as well as preventive measures to minimize the risk of transmission to others. Regular monitoring and follow-up with a healthcare provider are key to managing symptoms and preventing complications. In conclusion, while HSV can affect children and adolescents, appropriate medical care, education, and emotional support can help manage the virus effectively. Understanding the risks, symptoms, and treatments for HSV in this population is essential to ensure that children and adolescents lead healthy, fulfilling lives despite the virus. Managing herpes with other health conditions. Managing herpes simplex virus, HSV, becomes more complex when individuals are also dealing with other health conditions. The presence of comorbidities can impact the severity and frequency of HSV outbreaks, complicating treatment regimens, and requiring more tailored management strategies. It is essential to understand how various health conditions can affect herpes management and how individuals with multiple health concerns can still maintain control over both their herpes and overall health. For individuals with compromised immune systems, such as those with HIV/AIDS, organ transplants, or autoimmune diseases, managing HSV requires additional attention. A weakened immune system reduces the body's ability to suppress the virus, leading to more frequent and severe outbreaks. Antiviral medications are particularly important for these individuals as they can help reduce the frequency of outbreaks and the risk of transmission. Regular monitoring by healthcare providers is crucial to ensure that both the underlying condition and the herpes virus are properly managed. In some cases, the antiviral dosage may need to be adjusted based on the individual's overall health and immune function. Diabetes is another health condition that can complicate the management of HSV. High blood sugar levels can impair immune function, increasing the likelihood of HSV outbreaks. Additionally, people with diabetes may experience slower wound healing, which can make outbreaks of herpes more painful and take longer to resolve. Individuals with diabetes should work closely with their healthcare provider to control their blood sugar levels, as this will not only improve their overall health, but also help reduce the frequency and severity of HSV outbreaks. Managing stress, maintaining a healthy diet, and keeping active are also essential components of care for individuals with both diabetes and HSV. In individuals with cardiovascular disease or hypertension, certain medications may interact with antiviral treatments, making it important to discuss all medications with a healthcare provider. Managing both conditions requires careful attention to drug interactions, side effects, and overall health. People with these health concerns may also need to be more cautious when it comes to lifestyle factors such as stress and diet, as these can impact both heart health and immune function, potentially triggering HSV outbreaks. Managing herpes alongside any chronic illness requires a comprehensive approach that takes into account the complexities of both the virus and the other health conditions. Regular communication with healthcare providers, adhering to treatment regimens, and making lifestyle adjustments that support immune health can help individuals manage both herpes and other health conditions effectively. By combining antiviral treatment with overall health management, individuals can live fulfilling lives while managing HSV and any additional health concerns. Chapter 9. Looking toward the future. As medical research and treatment options continue to evolve, the future of managing herpes simplex virus, HSV, offers hope for improved outcomes and a better quality of life for individuals affected by the virus. The focus is shifting toward more effective antiviral treatments, potential vaccines, and better strategies for reducing stigma. While HSV remains a common and manageable condition, ongoing advancements in science provide the opportunity for enhanced prevention, treatment, and support. One of the most exciting prospects for the future of herpes management is the development of a vaccine. Although several vaccine candidates have been explored, there is no fully approved vaccine for HSV yet. Researchers are investigating different approaches, including vaccines that target the virus's ability to enter cells or stimulate the immune system to fight off outbreaks. The development of an HSV vaccine would be a significant milestone in preventing the spread of the virus and possibly even eradicating it in the long term. Such a vaccine could provide immunity to individuals before exposure or protect against recurrent outbreaks in those already affected. Antiviral treatments have already significantly improved the management of HSV, but newer medications and therapies are being developed that promise even more effective results. Current antiviral medications, such as acyclovir, valacyclovir, and famciclovir, are widely used to manage outbreaks and reduce transmission. However, ongoing research is looking into medications that can offer faster relief, more targeted action, or even longer-lasting suppression of the virus. Additionally, researchers are exploring treatment options that can help those with recurrent outbreaks manage their symptoms more effectively and reduce the frequency of flare-ups. Another key area of focus is the psychological and emotional impact of living with HSV. The stigma surrounding the virus remains a barrier to many people seeking diagnosis, treatment, and support. Education campaigns and increased awareness are crucial in reducing the social taboos associated with HSV. The future holds promise for a more accepting, open-minded approach to sexual health, where individuals can talk openly about herpes and receive support without fear of judgment. Greater understanding of the virus and its commonality could lead to better mental health outcomes for those affected by HSV. In conclusion, while HSV remains a challenging condition, the future looks promising in terms of treatment, prevention, and social acceptance. With advancements in science and medicine, along with increased public awareness, those affected by herpes may experience fewer limitations, improved care options, and more hope for a life free from stigma. As research continues, the outlook for people living with HSV is brighter, and a cure may one day be within reach. Advances in herpes research. Herpes simplex virus, HSV, research has made significant strides in recent years, leading to promising developments in both the prevention and management of the virus. Researchers continue to explore innovative treatments, potential vaccines, and novel therapeutic strategies that offer hope for individuals living with HSV. These advances aim to reduce the burden of the virus, improve the quality of life for those affected, and ultimately provide a path toward a cure. One of the most exciting areas of herpes research is the development of a vaccine. While no vaccine has yet been approved for HSV, several candidates are currently being tested in clinical trials. These vaccines aim to stimulate the immune system in a way that prevents the virus from entering cells or reduces the frequency and severity of outbreaks. If successful, an HSV vaccine could be a game changer in preventing the spread of the virus, especially in high-risk populations, and potentially reduce the risk of recurring outbreaks in those already infected. In addition to vaccines, researchers are focused on advancing antiviral treatments. Current medications, such as acyclovir, valacyclovir, and famciclovir, remain the cornerstone of herpes management, thus reducing the severity and duration of outbreaks and helping to prevent transmission. However, scientists are looking for new antiviral agents that target the virus more effectively with fewer side effects. These new medications could offer longer-lasting suppression of the virus, faster relief from symptoms, or even provide a more convenient treatment regimen for patients. Gene therapy is also an emerging area of research in herpes management. This approach involves using genetic material to either boost the body's immune response to the virus or to inhibit the virus's ability to replicate. Early studies in gene therapy show promise, but more research is needed before such treatments can become widely available. If successful, gene therapy could offer a long-term or even permanent solution for people with HSV, eliminating the need for daily antiviral medications. Researchers are also exploring new ways to boost the immune system's ability to control HSV. This includes investigating immune-modulating therapies that can enhance the body's natural defense mechanisms against the virus. By strengthening the immune system, these therapies could help reduce the frequency of outbreaks and lessen the severity of symptoms during flare-ups. In conclusion, advances in herpes research are bringing us closer to better treatments, preventive measures, and potentially even a cure for HSV. Ongoing clinical trials, innovative therapies, and a deeper understanding of the virus's biology continue to shape the future of herpes management. While challenges remain, the progress made thus far offers hope for those living with HSV, improving their prospects for a healthier, less disruptive life. Potential vaccines and treatments. The search for effective vaccines and treatments for herpes simplex virus, HSV, has been a central focus of research, with the goal of reducing the impact of HSV on individuals' lives. While antiviral medications have provided significant relief for many, the development of a vaccine and next-generation treatments holds the promise of better prevention and management strategies, potentially transforming the way we approach HSV. Vaccines remain one of the most exciting avenues in herpes research. Current clinical trials are exploring several vaccine candidates aimed at either preventing HSV infection altogether or reducing the frequency and severity of outbreaks in individuals already infected. The primary challenge in developing an HSV vaccine lies in the virus's ability to remain dormant in the body after the initial infection, making it difficult to create long-lasting immunity. However, some promising approaches focus on stimulating the immune system in ways that prevent the virus from reactivating or entering cells. Vaccines that target specific proteins on the HSV surface or trigger strong immune responses may offer a path to preventing future infections or minimizing the duration of outbreaks in those who are already affected. In addition to vaccines, advancements in antiviral therapies have greatly improved the management of HSV. Antiviral medications such as acyclovir, valacyclovir, and famciclovir are widely used to reduce the severity of outbreaks and suppress viral replication. These treatments are effective in shortening the duration of flare-ups and decreasing the likelihood of transmission. However, these medications only manage the symptoms and do not offer a permanent cure for the virus. Research into more targeted and efficient antiviral drugs is ongoing, with the aim of developing therapies that can suppress the virus for longer periods or even eliminate it entirely. Gene therapy is another potential breakthrough in HSV treatment. This innovative approach involves modifying the genetic material in the body to either directly target the virus or enhance the immune system's ability to fight off the infection. By delivering therapeutic genes to infected cells, researchers hope to find a way to either block viral replication or activate the body's natural defenses more effectively. While gene therapy for HSV is still in the experimental stages, it could offer a future where individuals no longer need to rely on continuous antiviral medications. Moreover, researchers are investigating immune-modulating therapies that could boost the body's immune response to the virus, reducing the frequency of outbreaks and improving long-term control of the infection. These treatments aim to strengthen the body's natural ability to fight the virus, potentially offering a more sustainable solution for those affected by HSV. In conclusion, while HSV continues to present challenges, the development of vaccines, advanced antiviral treatments, and immune-modulating therapies offers hope for a future where the virus is better controlled or even eradicated. As research progresses, these innovations could lead to more effective solutions for preventing and managing HSV, improving the quality of life for millions of people worldwide. The role of public health initiatives. Public health initiatives play a crucial role in the fight against herpes simplex virus, HSV, by promoting awareness, prevention, and early diagnosis. While HSV remains a common viral infection, efforts at the public health level are essential to reducing its spread, addressing stigma, and improving the overall health of affected populations. These initiatives focus on education, access to health care, and policy development to ensure a more informed and healthier society. One of the primary goals of public health initiatives is to increase awareness of HSV and its transmission. Many people are unaware that HSV can be transmitted even when symptoms are not visible, which contributes to the spread of the virus. By providing clear, accessible information about HSV transmission, prevention, and management, public health organizations can help individuals make informed decisions about their health. Educational campaigns can target high-risk groups such as sexually active individuals, pregnant women, and those with weakened immune systems to ensure they understand the importance of preventive measures and regular testing. Prevention is another critical component of public health efforts. Public health initiatives encourage the use of condoms and other barrier methods during sexual activity, as these can significantly reduce the risk of HSV transmission. Additionally, promoting safe practices like limiting sexual partners and discussing sexual health openly with partners can help reduce the risk of spreading HSV. Public health organizations also advocate for regular screening for sexually transmitted infections, STIs, which can include HSV, as part of routine health checkups. Early detection allows for timely management and reduces the chances of complications arising from undiagnosed or untreated infections. Reducing the stigma associated with HSV is a major focus of public health campaigns. The social stigma surrounding herpes often prevents individuals from seeking diagnosis and treatment, which can lead to worsened health outcomes and mental health struggles. By addressing these stigmas through education and supportive messaging, public health initiatives aim to create a more accepting and open environment for those living with HSV. This can lead to better mental health outcomes, as individuals are more likely to seek help and adhere to treatment regimens without the fear of judgment. Furthermore, public health policies can help increase access to care for those affected by HSV. This includes ensuring that antiviral medications are affordable and accessible, particularly for underserved populations. By improving healthcare access and promoting comprehensive sexual health services, public health efforts can significantly reduce the burden of HSV on individuals and communities. In conclusion, public health initiatives are vital in preventing the spread of HSV, reducing stigma, and promoting better management of the virus. Through education, prevention strategies, stigma reduction, and access to healthcare, these efforts contribute to a healthier society where individuals can live well with HSV, free from discrimination and fear.